Good morning, good afternoon, and good evening, digital health leaders around the world. Hoping that you are all doing well and enjoying your coffee, tea, cappuccino, adult beverage, wherever you are. And looking forward to taking a journey today over the next 3 hours to review the best in evidence over the different vectors in digital healthcare. We're really excited to have a packed agenda today, starting with Amy West from HitLab, talking to Sally Frank, who leads up the Microsoft for Startups program in health and life sciences, to talk about what's happening with certainly AI and all the other different verticals in healthcare and digital health that are popping up. And we're moving into, after that, an update from DLA Piper on what's happening these days with some of the new regulatory landscape around HIPAA and data rights. And then back to Amy at the 11:30 mark to talk to one of the country's best pediatric physicians and hearing what's going on at Washington Children's in digital health. And then wrapping up again with Amy at 11:45 around some of what's happening in women's health tech. And hour number 2 from 12 to 1, we're going to hear from more of some of the biggest leaders in digital healthcare around the country, including Jackie Kapoor from the AMA Venture Fund, Health 2047, about some of the funding alternatives that people can seek out these days in this new healthcare economy that we are all working on navigating. And then the third hour between 1 p.m. and 2 p.m. Eastern, we will be talking about and discussing more work around advancing equitable cardiovascular care, and then winding it up with Jerry Antamano talking about some of the exciting things happening with HitLab and the hub that many of you are already a part of. We'd love to get you all on there and get going on that as well, since there's a lot of interesting evidence and data about what's working in digital health being shared across the communities in the HitLab hub. First off, though, thrilled to have Amy West talking with Sally Frank from Microsoft about what's happening these days in the breakthrough companies that Microsoft is working with on the startup side. So handing the virtual stage over to Amy and Sally. Amy.
Hi, everyone. Thank you. Greetings, Sally. Thank you for joining us today. And we are going to be talking about, or the session topic is driving breakthroughs in health technology, startup strategies, and global insights. And Sally, coming from Microsoft in the startup space, I think you'd be a great person to share your perspective. But before we jump into the topic and the questions, could you just share a little bit about your background and your focus area when it comes to the startups?
Sure. And Amy, thank you, and Stan and the rest of the team for having me today. It's a pleasure to be here. So I focus on helping our health and life sciences startups grow and scale using Microsoft technology. And so through that, we really focus on identifying the tools that we have, the AI offers that we have, enabling them to build the best that they can and be enterprise ready. And so we've been doing this through the industry lens for about coming up on 5 years. Prior to that, Microsoft for Startups has been around for decades. But we decided to really hone in on a few key industries: health and life sciences, retail, cybersecurity, and of course, AI. And so I've been with the company for coming up on 10 years and been in this role since we kicked off this industry focus about 5 years ago. So it's a lot of fun.
Well, welcome again, and really excited to get your perspective in the work that you're doing with these startups. And so a couple questions. We'll kick it off with, from your perspective, what key factors differentiate health tech startups that are successful in scaling versus those that may be stalling early on?
So it's an interesting question. And I just completed, well, as of Monday, we'll complete a manuscript on my next book, which is called The Unicorn Protocol, where I've interviewed 10 unicorn founders from companies that we all know, and to really identify what are those things that lead to success. And you're probably going to think I'm going to say, well, they're really good scientists, or they're really good business developers, or they're leading clinicians. And the fact of the matter is that all of those people could be really good leaders in startups in digital health, But what I really see come through as those that are successful, they are mission first, ego is a distant second. They are learners, lifelong learners. They're coachable. And keep in mind that whether you're selling to a prospective customer or you're pitching to a prospective funder, that person that you're talking to is investing or thinking about working with the person in front of them. And so it's building that relationship and it's building a listening ear so that you can not be the first to talk about what you're doing, but listening to what the person, the prospective customer needs, and then responding appropriately. One of the things that we think about is having what I call proxy customers as part of your journey from inception all the way through to product market fit and scaling. And what I mean by that is identifying people that you would eventually want to sell your solution to, even though you don't have anything to sell, to get their feedback, to get an understanding of how what you're building might affect workflows, might affect patient outcomes, might affect costs or revenues. And so understanding and connecting with those types of people early on and then maintaining those connections through your journey really help. And I've seen this with a lot of the startups that I work with personally and many that I profile in the upcoming book.
That is really interesting insight. You really that need to not only have a strong IQ, but the EQ is extremely important. And that listening ear, as you mentioned, reminds me of a quote that I love. I heard many years ago from Peter Diamandis, who is one of the co-founders of Singularity University. He said, "Become enamored of the problem, not the solution."
Mm-hmm.
And in order to do that, you have to understand from the where's the problem coming from and who's experiencing it. You have to understand that and listen to them. So I think that's really interesting and really important that our audience here is listening to what you're saying and sharing here. That's
Right.
it's really insightful.
Yeah, we've all been down that path of here's a technology, let's find a problem. And as tempting as that is, especially with all the new shiny AI tools that we have,
Yes.
it's really important to put that aside and focus on the problem you're trying to solve, why you're trying to solve it, who's going to benefit, who's willing to pay you to solve that problem. Because if no one's willing to pay, if there's not enough ROI, then you might
Right.
have people go, yeah, that would be really cool, but I'm not willing to pay for it and all of that. So yeah, it's very tempting to lead
Yes.
with the technology.
Yeah. And I've seen that example of great idea. I'd love to use it, but I'm not going to pay for it. So it's a problem.
Yes.
But anyway, thanks for sharing that. I'm excited about, when your new book comes out, we'll have to be reading that. Thinking about women's health and, Hit Lab, we have the Women's Health Tech Initiative. I actually chair that part of the organization. And an area that's very near and dear to my heart in light of the challenges and disparities that we have in women's health globally. From your perspective, which emerging technologies or trends in women's health are you most excited about right now?
So one of the things that started, I think, in about 1993 was actually treating women as women. So until 1993, most clinical trials did not include women. So
That's right.
for the last several, centuries or whatever, we've been treated like small men. And that doesn't work. We present differently in a variety of ways, in a variety of diagnoses. So it's important that we separate what is a traditional male care pathway from a female care pathway. So that's one. Secondly, we have spent, and this is important, and I'm not trying to minimize this, but most of the dollars and efforts up until this point have been largely around reproductive health, which is incredibly important,
Mhm.
but we are not our wombs, so to speak.
That's right.
So now looking at how organizations, startups, innovators are looking at, say, cardiac care and how it should be different for women, how we look at diabetes and some of these other hormone focused diseases, but not like reproductive hormones, serotonin, those types of things, insulin. Like, how does that manifest differently in women's bodies? And then the other thing that I think is really interesting is that there's this recognition that women typically are the glue holding the family together. And so, whether it's caring for an elderly parent or children or whatever, women are that glue in most cases. And so, having an understanding of the mental health challenges, the overwhelming feeling that we have trying to manage work and family and health and all of that, and giving women tools, whether it's mental health tools, whether it's making the process easier for diagnosing your kid with an earache. We've got a startup in our program called Wavely DX. They've got an app and an add-on to a cell phone, so you can literally test for your child's ear infection at home. Like, those things are just golden for women and for men, but understanding the unique pressures that many women feel and then catering to that in a way that helps them move through life in a much less stressful way is just fabulous, and what we all need.
Well, I couldn't agree with you more. I agree that reproductive health, fertility is so important. It's been a big focus, but there are so many other areas, like you said, cardiovascular disease, which is the number one killer of women. 80% of people with diseases are
Right.
women, but we don't know enough about why that is. So I think that's fantastic. And then also the example of, the app for diagnosing an ear infection in your child. I mean, the stress that goes along with knowing that your child is sick. How am I going to get them in to see the doctor and all of that when you can just go to your phone would be a huge relief, both mentally, physically, and just support the entire family unit across the board.
I
So
mean, just the time alone to set up the appointment, make sure to
yes.
get, like all those things. If you can wrap it all up with a telehealth visit, here's the reading from my phone, that's great.
Right. And not to mention the fact they've got to get to work. They've got two other kids,
Right. Yeah,
all this other, life getting in the way. So that's
exactly.
fantastic. That's great to hear that you're working with an organization focused on that. So before we close out, I'd like to ask you another question. Really in the going back to sort of the startup sort of logistics world, from your perspective, what makes a startup pitch stand out to you personally? Like, what's going to really get your attention and your focus, especially in this very, very crowded digital health space?
So I think the number one thing is probably clarity. So if anyone's ever read what is it, the manifesto, anyway, it's this book that I read years ago about taking the corporate speak out of your language. And what happens when we get immersed and engaged with technology is that we start talking techno speak. And so the clear value proposition that says we help these people do this with this, and the results are, that's important. And it needs to be as simple as that to start with. The other thing that I think I see a lot of is people will pitch and then they'll end it with, well, that's what we do. And it's like, well, wait a minute. Like, what's the next step? Like, do you have a wedge offer? Are you asking for funding? Like, don't
What's
leave
the
it to
ask?
the person you're talking to kind of figure out what's next. Um, and then the other thing I think is really important is making sure that the market research that you've done, hopefully that you've done, is evident in what you're pitching. So if you are able to calculate ROI and share that based on a couple of clinical studies or customers or whatever, that's great. But it should be backed up with and here's how the industry is going, and here's how we can help. Here are some data points about these particular problems. Um, those types of things that show not only are you really good at pitching what your concept and what your solution is, but do you understand the problem set and have taken the time. And believe me, with Copilot and all these other tools, literally you can put in a prompt and get all the research you need. So it's not even hard anymore, but a lot of people don't take that extra step. So if you
Mhm.
have a total addressable market, which I'm always a little bit struggling with that because it's always way higher than it should be. But if you're doing that and you're doing the calculation for those that you want to approach, then have some research to back it up. Like, here are five top targets, and here's why. Or I'm coming to you because I read your strategic, or Copilot, read your strategic plan or your annual report, and this seems to be an area that you want to innovate in, and I can help you. Like, those types of things are so critical to giving you credibility, letting the person that you're talking to know that you understand their world. And thirdly, have taken the time to understand that person's world so they already like you a little bit more because like, wow, they've really done their homework. That's a good thing.
Well, and that research is kind of like that listening aspect.
Yes.
It's like extending it in a different way. It's so important to listen and understand. Well, Sally, we packed a lot into a very short amount of time, and I would love to talk to you much, much more. And I might even be tapping into you for the Women's Health Tech Initiative because I love the way you're thinking.
Great.
But thank you so much for your time, and we will definitely be in touch. And you can reach out to Sally on LinkedIn if anyone's interested in connecting. Thank you so much.
Great. Thank you. Thanks for having me.
Bye bye.
Bye.
That's fantastic. Thank you, Amy. Thank you, Sally. And again, Sally's LinkedIn link is in the chat box, which is open on this webinar. One of the few webinars that do have an open chat so that you can network and meet people and certainly meet the guests on the program. Next, we're going to be going into, again, a very evidence-driven program around what are the tactics, what are some of the plans, what are some of the pieces that folks need to utilize when they are generating evidence in the age of AI and machine learning. And we have two of the country's experts in that area, Tracy Weir, who's a partner at DLA Piper, and one of her colleagues, Daniel Kagan, who's an associate with the healthcare regulatory practice there as well. So I'm very happy to have, again, DLA Piper, one of the preeminent law firms in healthcare life sciences as well, here to help guide us through what are some of the legal and HIPAA issues that we face in this new era of evidence generation around AI and ML. But again, handing it over to Tracy and Daniel to help us walk through some of these issues.
Tracy and I are really excited to speak with you today. With the continued rise of artificial intelligence and machine learning, particularly in the digital health space, we're going to try and provide you with a brief primer on some hot issues regarding data privacy laws and compliance strategies as it relates to such AI/ML use. By way of some additional brief background, I'm a senior associate out of DLA Piper's New York City office in our healthcare regulatory practice. I focus my practice on assisting digital health companies with a full range of healthcare regulatory matters, including HIPAA and other healthcare regulatory considerations regarding the use of artificial intelligence and machine learning, both within healthcare and life sciences companies. I'll now turn it over to my partner, Tracy.
Thanks, Dan, and good morning, everyone. So I am a healthcare regulatory partner with our Washington, D.C. office of DLA. And my practice, like Dan's, focuses on HIPAA and healthcare data privacy, as well as regulatory matters relating to a range of issues, including payment for healthcare products and services. And in that, I work with all types of healthcare providers and suppliers, as well as the companies that provide products and services to those healthcare providers and suppliers. And this, of course, includes working with digital health platforms and the solutions they provide. So today, Dan and I have structured this session as really an informal Q&A where we'll be asking each other questions back and forth. So I'll get us kicked off here with our first question, and this one's to Dan, of course. So Dan, where do you see the biggest gaps in current U.S. data privacy regulation as it relates to digital health and AI and machine learning?
Thanks, Tracy. At the outset, I think it's important to note that while artificial intelligence and machine learning have been buzzwords for the last couple of years, particularly with the advancements of generative AI, the idea that we have AI and ML models is not in and of itself new. Additionally, I want to note that a lot of technology these days is labeling itself as artificial intelligence when really it's just acting as software. So currently, there are laws both on the federal and state levels that are already being adapted to AI and ML use cases. So we have HIPAA, which is obviously a topic that we're going to be discussing today. There's also Federal Trade Commission enforcement on the federal level that kind of enforce algorithmic use and disgorgement if you don't have the proper consent. But one gap that we see in the healthcare context is that while HIPAA has a definition for what constitutes de-identified health information, there isn't necessarily a uniform definition that can be used in all contexts outside of HIPAA. And we often see de-identification and anonymization used interchangeably within the industry. However, these days it's really difficult for information to truly remain anonymous, particularly when you kind of combine data sets with one another. All of a sudden, you're now linking patient data together, and you might see that the information that you thought was quote unquote anonymous is not actually anonymous. Outside of HIPAA, there's a patchwork of state consumer privacy laws that also make it potentially difficult to train and develop your artificial intelligence and machine learning models utilizing consumer health information. So, given some of these gaps, what we're kind of expecting to see is states to continue to take legislative action to try and regulate both the AI and ML model use, also regulating the privacy and security of those models, and then the data inputs that train such models. We probably will expect to see activity in more highly regulated states, including California and New York, and then other states kind of follow. So you look at the CCPA was the first preeminent law, then other states kind of followed suit with Washington, Nevada, and others. With regarding artificial intelligence in particular in healthcare, state laws are starting to develop and percolate, but for now they've been industry specific. So the use of AI in employment and insurance contexts or within the financial sector. But we expect to see kind of more laws develop regarding bias testing and other sorts of healthcare specific use cases regarding AI. Tracy, anything to add to that?
Yeah, I would just add, and we're going to touch on this in a few moments, but just in the context of the legislation that you mentioned, I think, the other place where just as a component of all of this, where I think that the legislation may touch upon is on consent and how you can get meaningful consent in this context. But that's foreshadowing a question to come.
Thanks, Tracy. So, Tracy, next question for you is what privacy and compliance strategies should early stage digital health startups prioritize when using patient data and AI tools?
Yeah, thanks, Dan. It's a great question, and it's a really important topic for startups and really any business that's trying to develop a solution. And it's often the case that startups are under pressure to develop and monetize that digital service as quickly as feasible. And, but addressing privacy and compliance considerations on the front end can really create substantial efficiencies down the road. And it also provides sort of a more insightful path, I think, to the business and really what you're doing with the data and the like. When privacy and compliance are not considered, or the flip side of this, out of the gate, there can be a need later on to retool or re-engineer components of the services, which is not always a desirable or costly situation or cost efficient situation. So for this reason, we think it's often helpful for digital health startups to consider as they're developing their solution a real privacy by design, security by design approach in the original build out. As part of considering privacy and security at the outset, this involves developing a working understanding, at least, or working with consultants and others on what the data rights laws are within the jurisdictions where the services will be offered. That understanding will help to drive part of the developmental decisions for the solution regarding the use cases of data and also when consents are provided, how they will be maintained, whether, and importantly, whether data needs to be segregated in some way within the environment to ensure compliance with the consents that may have been obtained or will be obtained, and with the data rights laws that apply to the solution and services. In addition, and because we're talking about healthcare startups here, it's always important to mention HIPAA. And just as an aside, for those that are not totally familiar, HIPAA is our federal healthcare privacy law that applies to covered entities and business associates. Covered entities are most healthcare providers and health plans, and business associates are the vendors and service providers that furnish services to those covered entities that involve protected health information. And really, HIPAA is a federal baseline or provides a federal baseline of privacy protections for protected health information. When it comes to privacy, issues, the general structure of HIPAA is that if a use or disclosure is not expressly permitted by the law, then the use or disclosure is prohibited. And the law also provides a baseline of security standards that need to be applied or addressed with respect to the information systems that maintain PHI. So I mention all of that because if the service that the startup is providing is going to be targeting customers that are HIPAA regulated entities, it's really important to understand at the outset that there are material limitations from the regulation and prohibitions on how protected health information can be used. And that, is can you use protected health information in your AI and ML systems? What are the permissions that you need to obtain with respect to derivative data sets, such as de-identified data for the use in AI and ML systems? That really needs to be evaluated, and those permissions need to be sought contractually. So, for example, if a startup is going to be a business associate under HIPAA, providing a service to a HIPAA regulated entity, the startup would need to have the right to utilize or leverage the customer's data in a de-identified form to build out their AI or ML model. They can't do that unless it's explicitly provided in the agreements. And that can be a challenge for startup companies trying to gain business, trying to expand their business portfolio, and trying to also improve their products. And in this regard, data segregation can become critically important. And as a last point here, I would just note that data is, particularly in the healthcare space, is seen as an asset. It is increasingly seen as an asset. And health systems and other kinds of healthcare providers and suppliers are taking much more aggressive stances on what they will allow with respect to the data that they have custody over and are charged with protecting. And so they're often not allowing the use of patient information or even de-identified data sets for purposes other than the provision of the actual service. And so it can be challenging to gain further rights for the use of data in AI and ML solutions. Dan, did you have anything else you wanted to add there?
Yeah, I think that's super helpful, Tracy. The one thing I would add is if you were trying to leverage other AI or ML tools within your organization, I think two important points. One would be to make sure that if you're a business associate, that you have the right business associate subcontractor agreement in place with those vendors. And then the other point would be to train your employees so they understand how to use leverage and use those tools effectively, but also in compliance with whatever data privacy laws apply to your organization. As Tracy touched upon this earlier, we want to talk a little bit about patient consent. So, Tracy, how can we ensure that patient consent is truly informed when data is going to be reused to train AI systems?
Yeah, thanks, Dan. This is a little bit of a challenging question. And really, to answer the question, we should first talk about what the underlying concern is with patient consent and AI. And the issue really stems from the evolving nature of AI systems. That evolving nature can mean that the use cases may not be fully understood, sort of future use cases may not be fully understood or even anticipated or known when the consent is actually obtained. So this in turn can create sort of a conundrum of whether the consent obtained is meaningful when it was obtained and whether it remains meaningful over time. So in general, the idea is that you want to develop a robust, transparent, and adequate consent that is also simple and easily understood. Those things sometimes don't go well together, simplicity and robustness. And that all of that coming together is the intent is to provide the data subject with an informed decision making, a tool for making an informed decision about what they're going to allow for the uses of their data. And this can be challenging. So we think that, as we noted, this area is evolving, is likely to evolve, and we anticipate legislation here may result and promote more robust protections over time. So in general, we would just note that there may be some general guideposts here that you may want to draft your consents as broadly as possible and provide for the fact that AI systems and use cases are evolving over time, and you may need to revisit consents as the AI systems evolve. Dan?
Just to close out, because I see we're at time, I think a closing and parting thought is to emphasize the need for cross-disciplinary collaboration when you're kind of working with AI and ML. So you want to make sure that you're not siloing your departments internally, but rather bringing together your technical teams, security teams, business teams, and legal teams. And together you kind of create an AI governance strategy to make sure that you're adopting AI and ML in the appropriate and compliant way. Thank you, everybody.
Thank you, everyone.
But what an amazing presentation and interview process. I love how we're having two guests interviewing each other. That saves me a lot of work. So thank you both for giving us an enormous amount of detail now on HIPAA and what we are seeing with AI and machine learning in the world of HIPAA and a lot of the regulatory privacy constraints. And I think their parting words were the most important, which were to stay abreast and have, just a regular update on what's changing every week, every month, because this is a fast moving regulatory environment. And it's not only fast moving on the federal side, it's fast moving on the state side. So as there are some differentiators there as well. Next up, we have coming back online is Amy West and Dr. Bekele from Washington Children's. And again, we're really delighted to have this session to talk a little bit more about the evidence in digital health, but looking at it from the little patient side and how the impact occurs there. But there's a lot happening in digital health with pediatric care, and it's always great to have someone who has that perspective. So handing back over the virtual stage to Amy West. Amy.
Thanks, Dan. And welcome, Dr. Bekele. It's so nice to have you joining us today and sharing your perspective. We are going to be talking about Little Patients, Big Impact, a pediatrician's perspective on modern child health. And before we jump into the session, I would love for you to share a little more background on your practice and your training and the work that you're doing at Children's National Hospital.
Hi, thanks for having me. So I am a general pediatrician by training. A few years ago, I started getting into clinical informatics and working with electronic medical records to make sure they work with our workflows and more efficient, working on design phase for implementation and trying to make sure that the tools we use are effective. I work at a community-based practice through that is connected with a hospital. So I have a lot of interest in addressing preventative care because we work with children, and that's a great opportunity. And trying to figure out tools that help us in the digital health world to make an impact on children as best as possible.
Wonderful. Well, thank you for all the work that you're doing. It is so important. And, a big part of what you do is obviously communication. And we know in healthcare in general, the doctor-patient relationship there can be a communication challenge there, as well as trust that needs to be a key part of that. And it's hard enough to do that with adults. But from your perspective, how do you approach those the right way to communicate and build that trust with younger patients as well as their caregiving adult parents?
Yeah. So I think it actually begins with the parents. The goal in pediatrics is to stay with the child through their life and build continuity. So when they're babies, obviously they're not really communicating. So you're building that foundation first with the caregivers, and that also goes to building trust with the kids. Once they grow up and they see that their parents trust you, they're more likely to do so themselves. And then trying to connect with them on an individual level, especially adolescents. we're always trained in pediatrics and medicine in general to ask open-ended questions so that you hear that voice from the patient, and taking that and making sure you are hearing them and listening to them and letting that inform the care you're giving. And we also use something called motivational interviewing when you are talking about behavior change, which is a whole lot of pediatrics when we deal with behavioral health. You need to assess what stage they're at in terms of making a change. If you know they need to stop playing video games 24 hours a day and eat better, but they are not at the stage where they are at all going to listen to you, if you just lecture them on the benefits, they're not going to listen. They're not going to communicate with you. They're not going to respond. So you really have to assess where the patient is, and use that in your future conversations.
Makes sense. And it's interesting that we had an earlier session with Sally Frank, who was with Microsoft and works with startups. And a theme I'm hearing pulled through, even in the clinical side, is the need to listen, and really listen to understand what are the true underlying problems here, and make sure that you are able to really understand and analyze and get the right solutions for them. So, and you mentioned earlier too, you're very interested and excited about the preventive care space, and hopefully dealing with younger patients, you might have an opportunity to intervene earlier. What are the biggest challenges that you face as a pediatrician when it comes to preventive care and those early interventions?
Yeah. I think it's two things. One is on actually the financial model side. Like, I went to a conference and they were actually talking about, like, our current insurance model is not geared toward preventive care. It is geared towards the sick person model, and which is the vast majority not what we're dealing with in kids. So the things that we need in order to address, physical activity, all this like cardiovascular risk factors, for later in life, we don't have many of those tools, and our visits aren't designed to address those, and it's hard to get reimbursement for those kind of things. So if anybody has any ideas on how to revamp the healthcare financing model, more power to you. I think the other thing is with families themselves, because healthcare is seen as that sick model, they need to see the value proposition in trying to prevent health. That means following up and coming to visits regularly. There's a guideline from the American Academy of Pediatrics that in order to address obesity, you need 26 hours with a patient face to face in a year or 6 months. That is a lot of visits, and it can't be all in the pediatric space. One, nobody's going to pay for it. Two, nobody has the time to come to the visits. And then when you're just thinking about the whole family dynamics, making a visit once, twice a year is hard for families. So needing to be in spaces where the family are so we can meet them where they are. Otherwise, there's just not enough time in the day.
Agree. And, that's, I think, an opportunity when we think about digital health. Yep. To leverage the technologies to be there where they are in a more effective, efficient way. So could you talk a little bit about any, obviously HitLab are very focused on digital health. I mean, are there any new tools or technologies or treatments or research developments in the innovation space in the pediatric area that you're particularly excited about?
Yeah, I think a lot of the precision medicine kind of innovation is very interesting, and especially a lot of the predictive models that people are working on. When you're thinking about prevention, you're thinking about risk factors. So predictive models that can identify the things that you can focus on are useful tools. I think integrating that more for the individual providers to use and connect that with the patients is where a big gap is, especially in pediatrics. Wearable devices and all that kind of thing are often more on the consumer side, and especially, at least I work a lot with, and children, and the vast majority of children in this country are actually on low-income insurances. So when you're talking about consumable products, it's a little bit more difficult to make that connection. So I think there is an opportunity, but that digital divide is part of the thing that needs to be addressed in order to make it available.
Agree. And I feel like in some of our discussion here, you've shared some real pain points and opportunities that when it comes to the coverage or the ability to get access. Again, these are areas where I do believe that digital technology data can really help bridge some of those gaps. And so for our audience and those in the innovation space, the startups, I mean, this is a very rich conversation about need and opportunity. So definitely, I think it's an important area to listen to and hopefully help solve for in the future. What from your perspective, again, you've been working in this space for quite a while, working with the little patients. What advice would you give to the people that are considering going into pediatrics and potentially considering a career in children's healthcare?
Yeah. I think I would say you should have an eye towards behavioral health because, like I said, pediatrics is a preventative specialty, and a lot of these things are things that are modifiable by working on behavior. But you need to look at behavior of adults as well as children. If the parent isn't going to make the change or help the child make the change, you're often going to hit a wall unless you have a very motivated older child who is pretty independent. Um, and then I also think that having a little bit of a background in digital health, because that is such a prevalent thing nowadays, you got to know how to use the tools to your advantage. Um, and lastly, I think just keeping your mind open into, I think in healthcare, there's a lot of opportunities, even if you're mostly practicing in clinical medicine, you need to branch out to like people management, systems, knowledge, all that kind of things, since it's you're working in the whole system, not just that individual clinic.
Yeah, it is a holistic approach in need. And I think that, I love that notion of there's such a huge opportunity in the pediatric space to lay the healthy foundations around, well care and preventive care that hopefully can be pulled through it, as people mature and become adults, because as we know, we have that sick care model, and so much of it is behaviorally based, and we just don't do enough as a society and as a healthcare ecosystem to address those things, whether it's in the child, the pediatric population, or adolescent, adulthood, and senior. It's a huge area of need, and that goes into thinking about social determinants of health and all these other areas that sit outside the traditional sort of clinical perspective. So I think that what you've shared is a wonderful perspective that can support not only the pediatric patient, but the broader, more general population down the road, and even today, quite frankly. So thank you so much for sharing your perspective. And again, I love that notion of really focusing on the preventive side and the opportunity that you have with the younger children. So thank you so much for all the work you do, and hope to have you back and talking again with us sometime very soon.
Thank you so much.
Fantastic. Well, thank you, Amy, for a great session again with one of the country's leading pediatric physicians. And we're moving from an overview of and some of the broader issues around digital health and pediatric care to very specific neonatal care and prenatal care with BirthView. And next up, we have an exciting startup that is going to review some additional evidence and some additional work that they've been doing on generating evidence around the prenatal and neonatal care area. And so I think one of the things that we're seeing that's important to remember is that, and I think most people know this, and Amy, you can certainly describe this as well, but we're seeing in the United States a substantial drag and just a lack of really solid prenatal and neonatal care, and the U.S. ranks 30th right now in those categories. Plus or minus a couple of spots for each one. And that's what Amy will talk about now with Helene and Roshane from Birthview. Back over to you, Amy.
Super. Thanks again. And would like to welcome again Helene and Roshane. It's always great to see you virtually, but also in person at the HIT Lab Summits, and always love talking with you. Our session is going to be Maternal Health Reimagined, and the New York City Healthcare Innovation Week reflections on innovation and equity. And before I jump into the session, I would love for Helene and Roshane to just give a quick sort of background on your bio and the work that you're doing at Birthview.
Sure. Can you hear me?
We can hear you.
Hi, so I'm Roshane Sasson, founder and CEO of Birthview. I have a background of computer science at Penn State, and I started this company after post-COVID, couldn't really find a footing in anywhere. And through working with OB at Hershey Medical Center, I really was drawn into this solution of helping moms with contractions, with their timing, and was able to create a predictive algorithm that now, moms are able to use to help identify their future contractions, timing of active labor, giving themselves the best outcomes. And so far, I've been able to build that company up, form clinical partnerships with hospitals, OBs, as well as just bring a great team together, including Helene.
Great. And I'm Helene Rutledge, and I was delighted to join Roshane as a co-founder and president and COO. And I have a background in the healthcare industry. I had senior global roles in companies like Pfizer and GSK, but then I founded Mend and Upgrade, two other startup companies in the digital health space, and actually, taking some coursework at Columbia Business School Digital Health, which really got me involved in this community. And what's so exciting about Birthview is that with Roshane's algorithm and predicting labor risks, we're building a device-agnostic remote monitoring platform, and it's going to support OBs and ultimately high-risk patients. So we're really, focusing on that data aspect. And our mission is to prevent avoidable complications and empower both providers and patients through earlier, equitable insights.
Wonderful. Well, welcome again. And so to kick off, I know you shared a little bit, Roshane, about what Birthview is, but let's get a slightly bigger picture. What really inspired the founding of Birthview?
Yeah, absolutely. So I would say what really inspired it were personal experiences. We all know the effects that resources can have on outcomes, but seeing the effects of timing, seeing my relatives going into labor and not really understanding, what their immediate next steps were. And for a moment like that, you could only imagine the thoughts that are going through your loved one's mind. So that's really what got me in touch with the understanding of this is a pivotal moment in time. And while working with this OB and just recognizing that underserved communities, minorities were 2 to 3 times more likely to die in a situation where we're in America. Like Stan mentioned, we spend some of the most money in healthcare, and yet these outcomes are so negative. And just to hear statistics saying, 60, 70% of these complications are avoidable just makes you wonder, how are we okay with this solution? How are we okay with this inequity that's going on where it's big, it's loud, it's screaming, saying this is a problem, but no one's really focused on it. So that really was a driving impact.
Yeah. Well, the personal passion is so important, and I agree with you. It is unacceptable, but it takes innovators like you to really move the needle. So, congratulations and kudos to all the work that you and Helene have been doing on this. You both attended and presented at the New York City Health Innovation Week Innovators event about a month ago, I guess beginning of the month here. And we actually had a chance to catch up a little bit. I certainly had a great experience and enjoyed a lot of the conversations and the topics, but would love to get your perspective on key takeaways as it related to topics around maternal health in the innovation space.
Sure, yeah. So it was really clear from the conference that maternal health is just underfunded and under-innovated. And in fact, the panel that I spoke on addressed the need to look to other sources, particularly as many federal grants have been frozen, and really pushing towards community-based resources. And, that like focusing locally allows you to really understand the needs of a particular community and, not subject to as many fluctuations as the federal situation. Another theme was that it's a public health emergency, what's going on, and tech alone can't fix it because social determinants of health, as you talked about in the previous session, like housing, transportation, all of these things must be integrated into the care models. And it starts with really listening to the patients to be able to meet them where they are and see what their needs are, and even though a lot of these solutions are digital, there is a digital divide. So as we design systems, we have to think about, can we put this on the lowest level of smartphone? Does the person even have a smartphone? Do they have enough, bandwidth for the solution you're designing? So the call to action really that I heard was that you have to center the birthing people in the design, especially the ones who aren't heard. Because if you're designing for, the mass of people who can afford solutions, you're excluding those who can't.
100%. And I really appreciate the reinforcement of the listening. This is a theme that we've heard earlier in some of our other conversations as it relates to to be successful as a startup, to be successful as an intervention, you've got to listen first and design for the true pain point of the person who's dealing with it. So clearly it's being pulled through in the work that you're doing. Can you talk a little bit about, how the BirthView platform is, supporting some of the, how you're able to engage with the communities through your platform and to help address some of these maybe disparities or inequities?
Yeah, great question. So overall, we're engaging with these communities because we understand that equity isn't an afterthought, first of all. It's a foundational aspect of what we're building. And we understand the impact of working alongside moms and those from historically underserved communities. So what we've been doing is making sure that we're co-creating this product with them, with their input and with their voices, because all of us grew up in different circumstances and situations, but really being able to understand that there are 10, 20, 30 different positions a pregnant mom could be placed in just from location, from resources that we may never understand and go through. So we're really trying to design it with them, have OBs and a full doula community as a part of it as well. And just ensuring that the small things are managed, whether it's language, having English, Spanish, various Asian languages on it, having usability, as Helene mentioned, where various versions of the platform can be accessible. Are we creating a solution that could only be ran on the latest iPhone versus one that is 10 generations back? So we're taking all of this into consideration, especially the patients and the moms, because their voices are ultimately going to shape how our product looks, feels, and functions as well.
Well, your passion for that human-centric design and that co-creation are coming through loud and clear. I think it's fantastic. And it's creating, I think, a lot of momentum for the success that you're having. How has the innovation community supported your growth as you've been continuing to build on that momentum?
So I'll start with the great story of how Roshane and I met, because we actually met through the HitLab ecosystem. Actually, Stan Kachnowski introduced us. And so we met at the first summit. And ever since then, we've been making more and more valuable connections. We connected with Carmen Minsal from the Mount Sinai DIH at another one of the summits. And that led to us winning the pitch competition there and engaging in their incubator. And that led to us getting a signed letter of support from Dr. Mohammed Ghaffar, who is the chair of OBGYN at New York Health and Hospitals. So all of these connections connections are really, fueling our momentum and, having us be right in that community where we need to be, working with the people that we're looking to design for. And we're currently beta testing with moms and getting great feedback after our first birth for you baby was born, as you know. But we're looking to do some testing in the Bronx, which I'm a native New Yorker, grew up in the Bronx. So I'm like so excited to be in the community working and, just seeing this getting in the hands of more and more moms. We have some video lately. It's just so exciting to see people reacting to the product.
Well, it's great to see, the innovation community as well as the patient community coming together to be a part of your platform. And also that, as a shout out to the HitLab network. I mean, we are here to create those networks and those connections. And I think it's a real success story across the board. So, really happy to be, supporting you as well through the work that we're doing here and to see your continued success. We're just about out of time, but as we close out, what role does cross-sector collaboration play in building equitable maternal health?
Yes, another important question, and it plays a very important role. As we see that equity in maternal health can't be achieved in silos, we can't do it alone, and tech certainly can't do it alone. We need collaboration across all fields to actually get a product like this in place and to drive equity. We need the OBs spreading word and awareness and getting their patients connected to innovation. And we need policy leaders. This is very important to help create a path towards Medicaid adoption where doctors could feel comfortable getting this product out to moms, and a wide variety of moms can get access to this because of insurance coverage. And so we're just creating solutions that are clinically sound and culturally relevant, accessible, and scalable. And this isn't just an equity mission statement. It's building a structure that we can actually see measurable outcomes from.
Yeah, agree. I think that's fantastic. And I do know that there are so many in our community and listening today that care about equity in health, especially in the maternal health space. Before we sign off, any final thoughts or messages to those that are a part of our audience today?
Yeah, I think most importantly, we continue to look for those connections. So we're looking for investors. We are currently fundraising, OBs and doulas, and you can reach out to us through our LinkedIn profiles or also info@birthview.com. We have an exciting event that's coming up in July, so I'm going to have Roshane announce that one.
Well, yes, as well. So we recently were selected to attend this year's 2025 Essence Festival of Culture. So, we're invited to New Orleans, just being a part of a cultural program that is now focusing very heavily on healthcare and innovation, being selected to really present BirthView on this global level that can see over a few million in viewership. So really understanding the impact that although we're just getting started, although we are looking for fundraising, we're not looking for interest. We're not looking for pilots. We have that sectioned off. We have OBs across a few states that are interested in piloting. And we're, like Helene mentioned, we're getting these letters of support. So we're just kind of using that to move forward, really garner traction and understand that, moms and importantly as well, doctors are seeing the value of this product. So just trying to accelerate and get it to them as soon as possible.
That's fantastic. And congratulations on that. And I think to all those listening in the investor space or the partnership space, now's an opportunity to be reaching out. You're going to be going on that global stage very soon. So congratulations on all your success. I know I've had the pleasure of watching you the last few years, and you've really been tremendous. And it's all coming from the heart. And I think that's really the key. So thank you for all you're doing, continued success, and we'll be watching. And, please reach out to Roshane and Helene if you're interested. So thanks a lot. Great to see you guys.
Thank you so much, Amy. And
take care. Bye.
Stan, take care.
Thank you again, Amy, for another wonderful interview with a breakthrough digital health technology, BirthView folks. Next up, we're going to be talking to one of the nation's leading investors in digital health platforms. Those of you who are not aware of 2047, it's the AMA venture arm, and they are doing a lot of very exciting things right now with a number of digital health startups across the country, and with a wide portfolio and a very active portfolio of investors and of digital health startups, and partnering with investors to bring those to market. Jackie, great to have you here today. And again, thank you for joining us. I know how busy you are. Maybe we could start off with just a few minutes on your own backgrounds and a little bit about 2047.
Thank you, Stan, and it's such a great honor to be here. And HitLab has always been such an amazing platform for my founders as well as investors to get to know the new founders. And I really appreciate the introductions you guys have given me and giving our portfolios and the guidance to our portfolios. I think that Medicurial, one of our portfolio companies, cannot speaking like singing the songs about what the help HitLab has given to him. And I want to say thank you very much for that. So anytime I'm here to help. And Health 2047 is, as Dr. Stan mentioned, it's a venture arm for the American Medical Association. And we are started at the venture studio in Menlo Park and have this goal is to focus on building solutions centered on the physicians and strengthen their relationship with their patients. Since the inception in 2016, Dr. Jim Madera, the CEO of AMA, giving us a mandate is to really effectively having this meaningful and measurable healthcare transformation. And that this is what we kind of are focusing on doing in our investment, right? My husband always joke with me saying that, hey, who has that number in the name 2047? What does that mean? And really it means that by 2047, it's AMA's bicentennial birthday. So that is what we wishfully thinking that we would make a huge impact for the healthcare system. And we have, since the inception of the company, we have invested 13 companies, and currently 10 of them are active. They covered from the cybersecurity in healthcare. They covered from the phenotypes in diagnosed obesity, what is helping you to gain and lose weight. And we have covered the digital side, the data side, like Medicurial, Medicare Advantage program. And recently, just in the first quarter of 2025, we just invested into a brain health cognitive for the early dementia, the AI foundational model. So we have been pretty active and in the investment side. Now, what I'm going to say is that we have a silent investment partner. I would call them our anchor investor. They will not in public allow us to put on a paper, but we can say that because it's on the cap table. That's United Health Group. So for every investment that we made at Health 2047, United Healthcare has been really amazing side by side and making investments so far.
That's a really great background. Thank you, Jackie, for that. And for the audience, if you have any questions, remember you can look up Jackie's LinkedIn. It's in the chat box, as well as mine, of course. If you've got any questions for me, feel free to ping me. Or I think, Jackie, one of the big things that we're seeing right now in this new healthcare economy is the funding has shifted dramatically. So we're seeing a number of cuts through not just Medicare, Medicaid, but also with NIH funding, et cetera. And so really the health system, even before these cuts, was teetering. And the funding now is switching in a very short period of time, literally, weeks, not months or years. And how are your startups adjusting to that? What are they doing to adjust to that? And what are some of the new and alternative funding sources that you're seeing them turn to for that?
That's a great question. And I would say this is a very turbulent period of time. And I think that we also going through, because the turbulent time is one thing, and then there's a macro impact of that. And we see that, both not only from the public side, but also from private side is having this head-on wind of the unpredictability, right? And we have actually 30% of my portfolio is currently in a raise. And then I would say 40% are geared to a major raise in Q1 2026. So what we have seen is that from both the market and our portfolio has shifting things in a few ways. So if you allow me to go through these shifting here, is one is that on the public side, on the market, what I have observed is that people are started obviously going to the more private funding. So the private funding, it's not just the I would say venture capitals, corporate ventures, or the I would say that the milestone-driven funds, right? But in the same time, is that they're looking at a mixed fundings using that private investment and philanthropy. For example, that I think that there is an article on Wall Street Journal talking about venture capital firms like Lux Capital. They have initial programs such as Lux Labs, which allocating about 100 million to support early stage academic research in biotech and AI. The goal of that they set up is to fill the gap left by the declining NIH funding. And then the secondly is to blend the funding models using, so for example, the 2025 Yale Innovation Summit, where that Reed Jobs introducing funding approach to combine philanthropy and venture capital to support life science research. So that is a kind of a very interesting combination we see in the public, in the markets that data has shifting. Now, the second part here is I would consider it's a little bit of what I consider like a internal challenge. Internal challenge is when you look at a company, you have to look at a company in a way that is just like your own cash statement, cash flow statement. You have the revenue, you have the expenses. On the revenue side, obviously for early stage, early startup, you don't have revenue. That's really your investment. So how can we increase the investment? And then the second portion is how can we manage our operating burn rate? So in the investment side, we actually in the first quarter of this year, we actually sold a company to a private equity. The purpose of that is the private equity is much better funded and they can give this company the gasoline for the growth. And we still hold a minority percentage of that, same as United. And for the purposes, we continue want to introduce our network to the company, right? But you see that the mergers and acquisition become a big piece for the companies that these are the activities that help the company to fund and growth. And the other part I would say is that for the founders is that let's look deeper of your operating costs. How can we find strategic partners and collaborations to really reduce that? What are the technology development you can be a possibility to develop in kind? And then secondly, how you control your burn rate. We have one company on the market raising capital because the market is so turbulent that the original raise has extended to be, I would say, to close around, has extended more than 6 to 9 months, right? In order to survive, they drastically cut down their burn rate by 60%. And the purpose of that is they want to extend their runway. So we need to look deeper inside is how we can extend the runway to help that. And then lastly is that, the federal cut is one thing, but there are ways to look at revenue cycle, how you negotiate with your potential customers, how you negotiate, looking at, how we can bring in the investors, strategic investors, not only being writing you the check, but can they be your first customer to hit the big differences for every startup is, are you post revenue or are you pre-revenue? How can we demonstrate the first revenue to show up? And lastly, but I think it's also kind of a little bit long shot here is that we need to looking at the state tax incentives. For example, that recently that industry leaders in Connecticut are pushing for a state level tax incentives to retain and attract biotech firms. So that is another thing that we can look, despite that the tax despite that the federal funding is reducing, how can we get that help from state as well?
Jackie, I think there's a book coming out of this conversation. You've got a lot of very good ideas here, and
Thank you.
The level of not only the breadth but also the depth of each one could be hours of discussions. And I'm sure there's a lot of startups right now that are taking notes and trying to understand how to dig into this, are there any online resources that point to a lot of what you're building here and a lot of the the things that you're referencing here?
So generally, like for me, I'm just a voracious reader, and every night I dedicated time just go through like Wall Street Journal, right, and New York Times. This is basic stuff. But I also I'm a heavy Bloomberg user and a PitchBook user, and this is the areas that I focus on, really looking at. Hey, what are the other venture firms doing? What are the recent transactions they are doing? And my analyst basically combing through what are the key transactions in specific sector applicable to the companies we have invested. And internally at Health 2047, we also provided the market comp for our founders, i.e. that we're combing through different stages for the purposes that for us to raise one round, you're always looking at the 3 rounds ahead of you, right? Who can your potential strategic investor? Who can you be your buyer? And who can you become a part of the merger acquisition target and the partners? These are the things you have to constantly looking at it and constantly challenging yourself. Now, don't get me wrong. Most of the founders I have encountered, they have very good understanding of their markets, and we are there just supporting the data and make sure that they understand that the competitive landscape has been changing very quickly.
That makes a lot of sense too. And given the fact that the funding landscape is changing so dramatically, how are folks like hospital systems and health plans and life science companies and even employers? I know you guys work with a lot of these folks and your funding partners here, and there's a lot of strategic funds that you see with large employers deploying capital as well to help digital health with their employees. What are they doing to step in and help out their startups in this time and this shift of healthcare economy works that are going on?
I would say that currently what we have observed is that from my portfolio perspective is that we have been very fortunate since we started a company. We have actually over 16 times the match for every dollar we invest. And we have some very good corporate venture as our capital partner. We have Dexcom, LabCorp, CVS Ventures, New Light PEs, and that's just named a few coming to my mind, right? And in addition to that, we also have a really good, strategic partners. We're using those technologies. Now, what are the things they have stepping into coming in from that? One is I realized that we just have to raise bridge round. And the between now and the next milestone, there is about 1 to 2 years in the current market. And I think that for the founders is that how you're going to work with your existing investors and have them to participate with you to do a bridge round before the next time you go to the market. That's a huge, huge component. And currently, I myself is negotiating about 3 bridge rounds for my portfolio. And these negotiations really come into how you entice the investors to put more money, not because they have to, but it's really how, right? And then the other part here is that what does that milestone entice you to the part that you're going to the bigger round, and what's that key differences you're setting to? And the other part here is that I think we sort of not touching upon all those hospital systems we are touching here. Don't forget there is another funding sources. It's your family offices and high net worth individuals. And family offices, particularly I like is they are far more mission driven. So they are return driven, of course, every one of us is. But then family office is high net worth individuals. We have been getting huge success in our circle is that they are the repeated investor. And also cross-pollination, right? So we have this investor with us invested in the very first company called Zing Health. It's a Medicare Advantage program started with 2 African American physicians outside of Chicago. And they just came to us and say that, hey, we have this idea. There are people who just not being covered underserved. And mostly the reason they're underserved is by social determinants of the health. We can help, but we need help. We need money. So we stood with them as co-founder, set up the companies and involved this investor. And as of today, that he has already repeated invested in multiple of portfolios after he's seen the success of Zing Health. Zing Health currently reaches 700 million revenue this year and 1.2 billion revenue next year. That was our very first company in Health 2040's portfolio. Our percentage equity position is diluted so much, but they still ask us to sit on the board for the special, for all the network and relationship we bring you. So your current existing investor relationship is hugely important. These are the relationship we have repeatedly brought into all our portfolios.
And that makes a difference. I think you guys have this holistic approach that's very startup friendly. Yeah. And obviously, coming in as the AMA's venture fund, you are very physician friendly. You understand the perspectives of patients and physicians so well, which is clearly what's driving a lot of your success. And looking more deeply into this funding gap that a lot of founders are running into, what guidance would you offer founders around the country who are navigating these volatile funding times and trying to figure out and navigate these new health economics and the U.S. healthcare economy in terms of being able to focus on the funding environment, especially folks that are focused on public or preventative health initiatives? That's a lot of what's being cut. So specifically for those groups like Birthview that just talked here as well, what guidance would you offer folks like that?
So I would say that's the same, I think, with offer every portfolio company. As a matter of fact, it's not just the public cutting the funding, right? It's really be scrappy. Look deeper into your operating expenses. How can we reduce the burn, right? And that's the number one rule. And then the second part is for now, because the funding is shifting to more private to fill the gap. So for private fundings, make sure you're tied to the milestone. When is your major product release? What does that mean? And when you break even, when does that mean to the EBITDA? And then the other part, don't forget, is that your milestone needed to be very precise, and then what are the dollar tied to that, right? And then lastly is that rethink your funding mix and then make sure that you communicate that story, your PR presentations in a way that is not only is a mission-driven piece, but hey, these are returns. I want to demonstrate the returns. Don't forget it. Without the public funding, you need to demonstrate your mission and your return, the full story.
That's great. Any final thoughts, Jackie? Again, we're getting tremendous feedback on your comments on the chat box and the chat for the Zoom meeting here. Any other points that you want to impart before we sign off on this session? I think we're going to have to talk about putting out a publication on this, Jackie. But before you sign off, do you want to give anyone else any other guidance on these important elements?
So at the Health 2047, we are very much supportive of the early stage. We actually sit with people as a co-founder with our founders. And we not only provided the initial seed fundings, but we are a full service company, i.e. that we actually helping people to build companies. We plan the people in fractional CFO, CMO, helping people to look at the product, sales, launch strategies, even compliance and regulatories. And I myself, whether you like it or not, my evening job after my day job is actually moonlighting for each of my portfolio companies as their fractional CFO, strategic CFO. So these are the things that we offer, and we would love to reach out to me, and we love to take a look at your investment thesis. We are early stage, and we don't do anything with FDA approvals, but other than that, it's a Wild West land.
That's wonderful, Jackie. Fantastic. And again, don't forget to look her up. Her LinkedIn is in the chat and you can see her there. And she is a regular member of the HitLab community. So be sure to stay in touch with that as well. Thank you again, Jackie. Have a great rest of May and a good summer.
Thank you, Dr. Stan. Always good to see you. Thank you.
Likewise. Okay, so we have now, we're entering the second hour, and we're actually almost at the halfway mark of the second hour, and we are very lucky to have with us joining next the chair of the Breakthrough Alliance board and the president of the Merck Global Health Innovation Fund, Bill Taranto, and he'll be talking with Jim Payne, who's with Actual Health Solutions, and really has become a cornerstone of the Hit Lab community. Former anchorman from one of the local outlets, the news outlets in Orlando, for roughly 25 years. Jim is a phenomenal expert in digital health, has a deep understanding of this, working with Actual Health Solutions and really leading their media efforts. And he's going to be talking to Bill about what's happening with the New York City Health Innovation Week. It's a new festival that started a couple of years ago. It's now entering its third year in 2026. And Jim and Bill are both big proponents, big sponsors of the New York City Health Innovation Week. It's the first full week of May every year, and thousands of people flying in from around the world to join dozens of events. And we're going to hear more about that from them now. Handing it over to you, Bill and Jim.
I'm here this morning with Bill Taranto, the president of the Merck Global Health Innovation Fund. Bill, it's always interesting to hear what you have to say because you're kind of on the front lines of this AI revolution that we're in the middle of. What excites you most as we move forward?
Yeah, I think, ultimately, from where I invest, we invest in something called pharma services, which in its simplest form is a pharma needs the service. That's kind of where we invest. So it's not just about Merck, but it's about the industry, but it's across the continuum from R&D all the way through commercial. And what's most exciting right now, and I just was fortunate enough to do a small talk on AI and ML and drug discovery and the advances around the potential of getting drugs to market in a much faster period of time, right? Really excites us. And we're focusing on three areas. We're looking across chemistry, biology, and vaccines, then multiple therapeutic areas. And the whole idea is, can we sort through reams and reams of information that a human can't do in at least a time period that one would want, and identify and validate a molecule or compound that gets it all the way through the development program into the market, and doing it 5 or 6 years faster than we do it today. And if you do that, drugs to market sooner means less expensive drugs, better outcomes and care for patients, which is ultimately what we're trying to do in saving patient lives. And so that's probably the most exciting area for us and probably where the majority of our investments in the last 3 years. We have some 15, 17 investments just at AML, drug discovery. The other interesting area that's exciting us, and most people don't talk about, and I just briefly mentioned it in my talk, was around the supply chain. Where AI is because it's all data, if you think about supply chain, and AI in using those kind of algorithms to better track raw materials coming in and finished goods going out. Pharma loses a lot of, of our medicines to theft, fraud, damaged goods. We ship it the wrong way. So how do you think about better understanding the logistics highway, if you will, by analyzing the data faster in a more sort of profound way using AI, and even creating things like digital warehouse twins, where you can have a digital twin of your warehouse, and if something falls off, we see it in the digital twin. And so using AI as a way to improve our cost efficiencies in the way we think about our supply chain is really big. And as soon as you'll actually start seeing it move to manufacturing. We're not quite there yet as an investor on the manufacturing side, but we're starting to think about it. And of course, we have to be a little careful on the access to care side, but AI is starting to creep in there, but we have to be very careful from around legal and ethical, reasons around the use of AI there, because we might find something out about a patient we didn't necessarily want to find out, right? And probably the last big area for us is real world evidence and data. That's still a big area of using AI to better understand the data that we're collecting, for both pre-market and post-market analysis, for the pharma industry. So really exciting stuff, but I would still say that drug discovery, ANML and drug discovery and clinical development is probably the most exciting space.
Well, if you can shave 5 years off the development of a new drug, I mean, that's basically cutting that time in half. That's just a total game changer.
It's huge. It creates such efficiencies and hopefully better care. Now, ultimately, nothing's been validated yet, but we feel we're so close. We think within the next year, we will see a validated drug. And it doesn't, whether it's one of Merck's programs or someone else's, as long as somebody gets it done, compounds itself. It's just getting the first one be fully validated and out the door, and it'll just then snowball, as they say. So, very exciting.
One of the challenges that you talked about in your speech was talent and finding talent and competing with other. AI is growing exponentially and it's getting better exponentially at the same time. And it seems like you have to say, hey, we're over here,
Yeah, it's tough competing. I don't think people always understand when they're graduating and they have those types of degrees that life sciences is an option for them. I think the first thing they think about is, oh, I need to go to a big tech firm like the Apples and Googles of the world, and all these new big AI companies that are recruiting heavily that aren't in the life science space. But this is one of the fastest growing areas around the use of AI is within healthcare. So not just pharma, you think all parts of healthcare, from the hospital system to the payer to the provider, they're all going to be starting to adopt AI. So the availability of jobs, I think, in this area is going to grow exponentially. But recruiting them is hard because we may not be able to pay like the other industries perhaps pay. But there's all ways you can think about, compensating somebody to get them to join. But the bigger idea is just getting the word out that we exist. We're looking for your kind of talent, even though you might not think initially that, oh, life science, I need to be a doctor, or I need to be, bench scientist. No, not necessarily, right? There's all the jobs that one can imagine exist in a big pharma, from accounting, finance, sales, marketing, what I do, venture. So one of the interesting jobs is, how do you think about using, this technology talent within, R&D. So to me, it's a great opportunity for the future of employment, for our industry.
2-3 years ago, we're all talking about the potential of AI in what we do, and now we're seeing it being executed and refined and gotten a lot better. How much more development do you think that's going to take, or is it just a matter of time before we have that breakthrough that you mentioned?
Well, I think there's going to be the breakthrough in a shorter period of time, but think of it so we're in the infancy stage of AI in healthcare. If you think back when I started the fund in 2010, I use this analogy, monitoring was brand new. And today we can monitor everything. The devices are so small, they collect so much data, and there's almost anything you can't monitor. But if you think back in 2010, we couldn't monitor anything. In fact, probably the only area it was being used was in cardiovascular. But the growth over a 15-year period, it's ubiquitous now. I think we're in the infancy stage of the use of AI. We're still learning how to use it properly. What are the effects of it? But it just takes these breakthroughs that then starts to snowball everything. But I still think we're in the infancy stage of the use of AI.
How important is it for you to keep coming back to HitLab summits and talk to people and interact and find out what's going on?
So I do this for a couple different reasons. Everybody always asks me, it's a way to give back, but it's about community. And in order to make healthcare work, you have to build a community amongst all the players within the system, right? Whether it's the regulatory people, whether it's payers, providers, patients, investors, entrepreneurs. It's a whole community that needs to work together, because the ecosystem can't work with point solutions, right? It needs to be an integrated solution of people working together and systems working together. And what HitLab does, aside from what HitLab in and of itself, from the science side of validating, technologies, the Breakthrough Alliance is the community part. And that's obviously where I come in as chair of the Breakthrough Alliance in the United States, is how do we grow this community, and how do we give back to the community? And as you saw, there was announced, this year we did a full launch in Europe. So we now have a counterpart to me in Europe. And our goal at the end of the year is to announce an Asia Pacific lead and do a launch next year in Asia Pacific. So how do we keep growing this? And then the year after that, Latin America. So keep growing the community and the Breakthrough Alliance on a global basis, because healthcare is global, right? And community is global, and people that need healthcare, it's everywhere. It's not limited to the United States. People get sick everywhere, and people need good healthcare, good outcomes, good access to healthcare. And it all starts with building the community. And that's why I come to all these events for that HitLab.
Yeah, it's important to stay out front.
It is.
Yeah.
It is.
All right, Bill. Appreciate your time.
Thanks so much. I appreciate it.
What an outstanding interview. Thank you again, Jim, for leading these interviews. Just an incredibly insightful interview about what's going on in digital health, particularly with the supply chain, and how improving that can improve getting medicines to patients around the country. All right, next up, we are moving into the second half of the program, and we're going to be hearing from Jefferson Lin, who's an associate from Fenwick, and he's going to be talking about how to navigate some additional legal risks that we're seeing pop up as we're looking at evidence generation in AI. And again, as you know, HitLab is one of the leading digital health testing facilities in the world. We do over 200 studies a year. AI is one of the big things that we are testing. And so looking forward to hearing from Jefferson. hopefully I'll pick up. Looking forward to learn a few things myself. Jefferson, welcome to the program.
Good morning, good afternoon, everyone. Excited to be here. This is my first Hit Lab event, and the sessions so far have just been tremendous. I'm Jefferson Lin. I'm a technology transactions and IP attorney at Fenwick and West, focused on advising digital health startups. And today, I'm going to dive into something that's increasingly critical for healthcare and healthcare startups, the legal risks associated with AI. I could probably spend an hour or more on this topic, but since I only have 15 minutes and won't be able to dig into every potential legal issue related to healthcare AI, like a law school exam, I'll use a hypothetical scenario to make these concepts a little bit more tangible and relevant to how AI is being deployed in patient care. Just quick disclaimer, information I'm presenting is, again, for informational purposes. I'm a lawyer, not your lawyer, and this presentation is not legal advice. Let's see. Yeah. So to kick us off, I was listening to the Dwarkesh podcast, a great podcast to listen to. There was a bit of this session with Microsoft CEO Satya Nadella talking about AI, but then he was talking specifically about the legal barriers and some of the legal challenges to AI, and just wanted to share this quote with you. And yeah, he just hits on a core challenge, sort of our world, our laws. Our entire society is built around human agency, human property, human rights, human liability. And so as we start to delegate more authority to AI, and especially in critical areas like healthcare, our existing legal structures are stretched and challenged. So while the tech is amazing and rapidly evolving and what it can do, the questions around what it should do and how we hold it accountable are going to be just as important. So and the legal framework is oftentimes playing catch up to the rapidly advancing AI capabilities. So I wanted to introduce the audience to our hypothetical client today, Receptionist AI. They've developed an exciting AI system designed to triage patients in medical clinics, helping to prioritize the most urgent cases. So imagine all the efficiency gains from this AI system. But as they prepare to license this system to a clinic network calling Care Connect, they're understandably asking some important and tough legal questions. And so in the presentation today, I'm going to try to frame our discussion around our hypothetical client questions. So the first client question is around privacy. How do we ensure our AI complies with HIPAA and other privacy regulations? And I'm not going to spend too much time here. Daniel and Tracy from DLA Piper gave a great overview and had a great discussion about the privacy issues related to healthcare AI and some of the gaps and some of the important things to watch out for. But in this sort of hypothetical context, as the AI is handling patient health information, connecting with medical records, um, most likely ingesting information about patient symptoms and diagnoses, this is highly sensitive data. And so the big law here, of course, in the US would be HIPAA, which mandates how this data should be protected. And there are rules around the technical safeguards like encryption, administrative safeguards around how the staff handles the data, as well as physical safeguards around sort of how to protect the computer systems. And in this scenario, because our client Receptionist AI is handling Care Connect's patient data, they will most likely need what's called a business associate agreement or BAA, which is a special contract that legally obligates both parties to protect patient data according to HIPAA. So it's something that's required under law. While it's sort of non-negotiable, it is that the terms of the BA can be negotiated. And one of the things I see startups do is sort of just not really review the BA that's presented, oftentimes by a health system or by a health payer, and just sign it. Oftentimes there are additional provisions within that BA to to look out for or watch out for. And one of the things that Daniel and Tracy mentioned was sort of the rights around data and rights to de-identify data. So those are some important provisions to look out, especially if that's going to be core to the startup's business. Beyond HIPAA, again, depending on where the patients and parties are located, other state privacy laws like California CCPA or even international laws like GDPR could add more requirements. Another thing that I've been seeing more and more is with these AI systems, if there's a chatbot involved or a recording of phone calls, state wiretapping laws such as California's Invasion of Privacy Act could also be implicated, and additional consent can be needed in those situations. So um, the next client question that we have is around IP. How do we protect our IP while allowing the customer Care Connect to customize? And so this is a very common question and tension. And so oftentimes the answer here lies in making sure uh, we're carefully crafting the license agreement or the MSA. And so the document is going to cover business terms, but it's also going to define the rules of engagement. So I would want to know, what does Care Connect want to customize specifically? Is it the branding? Is it the workflow integration, specific reporting features? Do they want to modify certain logic with the triaging? Um, what um, what can Care Connect see? Will they have access to the underlying code? Um, who's going to own the new features developed? So, with this question, looking carefully at the IP provisions in the contract are going to be critical, and making sure, again, if we're representing Receptionist AI here, one, identifying what is the core IP, right? It could be the trained model, it could be novel algorithms, the source code, proprietary data sets, how the data was curated, system architecture. Any customizations for the customer could potentially be license backed, or ownership could stay with Care Connect if it's sort of more of a peer configuration, but it should be explicit. One of the things I see with startups, they may unknowingly agree to sort of work product or IP assignment provisions that say IP generated in connection with the services performed by the vendor, or at the customer's request becomes the IP owned by the customer. So this can be very problematic in terms of protecting the startup company's IP. And so it's crucial to make sure that it's not structured as a development agreement where the vendor is creating custom code that's being owned by the customer. So other things to sort of watch out for are the confidentiality provisions. Again, ensuring that Care Connect here doesn't misuse or share Receptionist AI's proprietary information. We'll also want to make sure sort of robust use restriction provisions are in place to ensure Care Connect doesn't try to steal or reverse engineer any IP. Another question from our hypothetical client here is around bias, right? What are the risks of bias in AI, and how can we mitigate them? And so this is sort of one of the biggest ethical and legal risks now in AI. As we know, AI learns from data it's trained on, and if that data isn't diverse or it reflects existing societal biases, the AI will unfortunately learn and perpetuate those biases. And in healthcare, this is especially critical. And with a sort of triage AI system here, it could potentially mistakenly deprioritize certain patient groups, leading to delayed care or worse. So again, mitigation involves using, diverse training data, constantly testing the AI's performance across different demographics, and in this context, remembering that AI is a tool, and should be used with human oversight, with clinicians sort of making the final call. Um, the sort of fourth and final question that we'll sort of discuss here is around liability, and probably one of the most daunting questions. What happens if the AI makes a mistake, and a patient is harmed? And so this is a really complex area of law that's still evolving. And generally, it's not a single point of failure. Responsibility can be shared between the AI developer, here, Receptionist AI. It could be shared with the healthcare institution, Care Connect, as well as the individual user. So it could be the physicians or nurses or other staff. So again, key protections through contractual language are going to be important for Receptionist AI, including clear disclaimers that AI is a support tool or a technology platform, not a doctor. Other legal provisions and clauses like indemnification should be carefully reviewed and negotiated. So, who pays if something goes wrong? Um, Insurance provisions are going to be really important to consider. And, in addition to sort of malpractice insurance requirements or product liability, we're also starting to see insurance products specific to AI sort of risks. So there are insurance companies, for example, offering endorsements to expand usually cyber coverage to address risks like data poisoning. So what if attackers manipulate input data to compromise the outputs of AI models? The coverage might include covering infringement issues around the AI model incorporating copyrighted material. And the coverage could also cover regulatory violations. So violations of, for example, the EU's AI Act. So something to think about and explore, especially again if you're deploying or developing these AI tools. So those were the client's questions, but as lawyers, we're also wanting to examine and look at what hasn't been asked, right? And in AI, there are definitely some other sort of red flags to look out for. One of the biggest for healthcare AI is FDA regulation, and so a big question here that the client didn't ask is the Receptionist AI system considered a medical device? And if so, it can face a rigorous and costly FDA approval process, which can be a game changer for any startup. So, and in this case, while the name Receptionist AI may sound fairly benign, if it's triaging patients in medical clinics and helping prioritize urgent cases, we definitely would want to engage FDA counsel or FDA expertise here to see how the FDA might classify it as a medical device. Examining what the intended use here and whether it would affect uh, how it would affect clinical management and potentially the outcomes of diseases or conditions. So again, super important question to ask here, that again we could spend a whole nother presentation on. Um, and lastly, I know we're getting to time, but some of the key takeaways around anyone building or implementing AI in healthcare. The first, again, is engaging legal counsel early. Being proactive is going to be far cheaper than reactive litigation. Being transparent about what AI does and doesn't do, documenting decisions and test results. Um, Third, embracing the human in the loop principle. While there's sort of more talk and discussion about agentic AI, I think again with clinical solutions and direct patient care, that human oversight is going to be important. Fourth, AI isn't static. It's going to, compared to traditional medical devices, there's going to be more continuous monitoring. And again, the risks are significant, but they are manageable. And with, again, thoughtful planning and legal counsel and partnerships, AI can, I think, really be transformative for healthcare. So I know that was a lot in 15 minutes, but just want to thank you for your time. Feel free to reach out if you have any follow-up questions over email. Happy to connect over LinkedIn as well.
All right, so we are going to move into the last part of the second hour with a presentation from Finn Partners, one of the global leaders in healthcare life science communications. And one of the key things about the overall adoption of digital health technologies is how people are able to communicate their value and communicate their pinpoint effort, as we heard a lot of the speakers talk about today, whether it was Jackie or Bill or Sally, talk about how it's important and how the technology is being messaged in order for the people, in order for folks to actually understand when and where to make the purchase or make the investment. So with that, now we have a great team to lead this conversation. Laura O'Neill, who's a partner at Finn in New York City, and Glenn Silver, who's also a partner at Finn and Lazar. So Laura, Glenn, welcome to the program.
Laura and I are here to discuss shaping healthcare narratives in today's media environment. As you mentioned, both Laura and I are partners at Finn. We work specifically in the Earned Health Media Group, which means that it's our bread and butter to sort of coordinate, plan, and place stories with the national, regional, and local healthcare media. Just a word about Finn Partners. We are a global public relations agency. We represent many sectors, one of which is health, which includes, as we are discussing today, digital health, health IT, but also life sciences, pharma, medtech, across a variety of sectors that touch our healthcare environment. So it's great to be here today. A question, we often talk with clients about is, why are media relations important to health IT companies? There are really a variety of reasons. Number one, the media is a conduit, and what they generate builds trust and credibility with their key audiences, whether it's consumers, whether it's healthcare professionals, or whether it's people on the street. This is a way to reach them and establish yourself as a trustworthy and credible source. It also accelerates market awareness and business growth. It's a time-honored tradition. People like doing business with companies and people that they trust. And this is one way to make sure that you're seen as a trustworthy partner and grow your brand. You're also shaping your narrative, not just the fact that you exist, but the fact that you're bringing about positive change. Good, reliable media coverage can show how you play into the overall environment and why you are helping to not only bring about positive change, but sort of usher healthcare IT into the next environment, into its next stage. And most importantly, you're positioning your executives, not only just people behind a table, but as thought leaders whose opinions matter, thought leaders who are supporting change, and as thought leaders whose word means a lot across a variety of different audiences.
Hi, everyone. Good afternoon. As Glenn introduced earlier, my name's Laura O'Neill, and we're really excited about this presentation and the following slides that we have for you today. Because as part of our work, and Glenn started to talk about what Finn Partners does, but what Glenn and I do specifically in public relations is constantly speaking with journalists. We use their insights to understand what is going on in the media landscape, and we take that back to our clients who are looking to us to help them navigate the media landscape with the ultimate goal, right, of getting ink and positive press for them. So the rest of this presentation, as you can see here as a methodology slide, is that we spoke to these reporters informally for a survey. Again, we asked them about what shapes their media coverage and what their thoughts are on the biggest and emerging trends in health IT. For the audience here today, almost 100 of us, that's so great. But I'm sure you all are thinking about ways that you can get your companies or even yourselves into the press with journalists. And so this open door, this open communication with journalists is a great way to do that. So we're excited to share their thoughts in the coming slides. So let's get into what we asked them.
With regard to this open doorway into the media, we started our survey with what would you consider to be the biggest news topics today in health IT and digital health. Probably of no surprise to anybody on the call, artificial intelligence, AI, took the number one spot at 53.2%, followed by cybersecurity challenges, integration of wearable technology, implementation of electronic health records, and other various topics associated with technology and its use. But knowing what reporters are interested in and what they've decided to cover is really a very practical way into their coverage. If you have any direct or indirect ties to artificial intelligence, chances are you'd want to figure out a way to reach them, talk to them, and figure out ways that you might be able to complement any coverage that's coming down the line. And again, it might not only be about promoting what you're doing, it might be your opinions, your thoughts, where you stand on artificial intelligence and its use. Look at any major newspaper today and you'll see something about artificial intelligence. And with that in mind, it's really, really important to figure out where you are on the playing field and what you can and how you can possibly contribute to this ongoing coverage.
We also asked them, what do they see as the topic or the headline that's going to continue in the future? And it's still AI. We are in such an uncharted time with AI that reporters are using their roles to educate and inform. And AI is something that they want more information on and their readers want more information on. So you can see here, that's almost 50% of the pie of the reporters that we surveyed see AI in the future. What I want to call your attention to as well is the other sides of this. You can tell that they're split in terms of what news topic within health IT do they see as being more prevalent. And what that tells Glenn and me as we were analyzing this is that there are different viewpoints and different definitions into what entails health IT, right? It could be mobile health. It could be augmented reality. It could be telehealth. So these reporters at their individual publications see these topics growing, but also see their definitions of what that is. So as Glenn said, when we look to work with reporters to understand how they cover AI, or in one case, or in another, how do they define and cover health IT, matching up those strategies also helps increase your chance of getting the reporter to cover your client, your company, yourself, if you are also kind of speaking the language of where and how they're writing for their readers.
Part of working with reporters is not only understanding what they want to cover, but understanding, what are the misunderstandings in this space and why it's important to clarify any gaps in knowledge. Because, artificial intelligence, there are so many different schools of thought. As Laura said, as many as there are accurate, there are myths and misconceptions out there. So a really good way to work with the media is by telling them what is accurate and reliable. Talk about what is being misrepresented in the public sphere, whether it's through other media or whether it's through, public speaking or through anything else. But talk to them what is being misrepresented. Obviously here, concerns about AI replacing human healthcare took the number one spot. But data privacy, there's a lot of misinformation about that as well. There are a lot of people out there that think that by, putting their information into a digital form will lead them open for, big misunderstandings or big breaches. Belief that telemedicine offers inferior care, that's another one that, if you're a player in the space and you want to be a trailblazer, these are misconceptions that you can straighten out with accurate and reliable information. Also consider the underestimation of the importance of digital literacy and IT tools. These are things that I think reporters, a lot of very high profile reporters, would be open to hearing from you with accurate and reliable information again, but specific examples as to why it may not be true.
So the rest of our final two questions for the journalists, we're looking not at what they're covering, but the inner workings of their work and what they want to cover and what their preferences are. And these insights really reveal the vital role that journalists play. As I mentioned earlier, they're not just here to report. That's definitely a very important part of it, but they're here to clarify information. And the work that they output really underscores why our work as PR practitioners must go beyond just generating buzz for our client, but to help deliver messages that educate and inform about what is going on from our clients and from the general health IT landscape. So you'll see here 60% of our surveyed reporters, when asked about what most routinely determines the stories that they're covering, 60% said technologies with the potential to transform healthcare delivery in IT and health coverage. Was the biggest one. And that was just as important as stories that align with current healthcare challenges, right? This might seem very obvious to you, but when we think about what we call pitches to reporters or those initial conversations, sometimes you miss that selling point of what difference you're bringing or what value you're creating in the landscape in the industry. And so it's so important to reinforce that. I think just under that, you'll see insights from healthcare. That is the first part of insights from healthcare professionals and patients, which shows us the importance of that thread of human voice. It is one thing to talk about your benefits, and we definitely want to help shape that narrative and make sure reporters are understanding of the value your company's bringing, but also having those third-party advocates to talk about the meaningful change that your company's technologies have brought to them helps the journalists to put that finer point and to illustrate that. And that is what is the secret sauce of getting that ink is really being able to articulate those stories. I think the last piece of this chart that I'll chat about today is that healthcare policy and regulation definitely was at the top as well. And I think for that, reporters are just trying to understand what's going on in this very ever-changing landscape. So to be able to, again, as Glenn said earlier, bring back your points to what's going on in the current news cycle.
Question, it's almost answers itself. Do you see news coverage about health IT and digital health growing in the future? Now, of course it will. As the technology develops, journalists will start to devote more ink to covering them and talking about how they play into today's healthcare paradigm. The point is, as you have something to communicate, do so. You can do so in the context of clinical trials. You could do so in the context of publications. You can do so in the way of contributed articles. There are a lot of ways to contribute with reporters, but if you don't do it, they won't know about it. 3 key tips, though, as you consider communications and begin to ramp up the machine. Think about the overall story. Reporters might want to interview all those involved, whether it's a healthcare provider, a patient, the person who's responsible for the technology. You need to put out good information, but you also need to make the players behind the story available and be ready to provide details. These reporters, as you all know, are in the business of medical science, and the numbers matter. Accessibility to the research matters. a glimpse inside the lab matters. This is what reporters will not only want, but will insist on having at their disposal before they start to seriously consider generating coverage. And again, the necessity for validation. You need to show how it plays, how it looks in the real world. Okay, not only just from the boardroom, but how it looks and bring in real people with real stories, with real experiences. That's the best way to sort of pass the threshold and get reporters committed to developing a story. Be a resource. Understand these are real people with real deadlines and real jobs. Be a resource to them and help them generate their coverage. And chances are you can use media relations as an asset to promoting yourself to the outside world.
All right, with that, our 15 minutes are up. Thank you so much for your time. Thank you to the journalists who participated in our survey. Glenn and my emails, as well as our Twitter handles, are listed there, and we'd be happy to continue the conversation. Thank you so much for tuning in.
HitLab Community is an incredible presentation. Just if you're trying to have more empathy for journalists and understand how to communicate with them and to them better, then effectively that is your 15-minute 101 on how to work with them. And that's just great. Thank you both. And we are on our hour number 3, and we've got a lot more to cover. So hopefully you have a really good cup of coffee and a really good seat somewhere in the world to hear more about what's happening in the world of digital health evidence from people that are out on the West Coast that are teaching and practicing, to people who are working with health plans and leading the charge for patient care, to digital health startups who are working hard to develop solutions for patients around the world. And taking you through the third hour will be HitLab's own Jerry Antamano, who heads up our community development efforts. Jerry, handing over the digital health stage to you.
Good to be back on the HitLab Symposium. It's been great to hear from a lot of the presenters and speakers today, especially those who took part in our HitLab Summit earlier this month. And another who is coming up now, speaking to our very own Global Director, John Hammett, is Dr. Effie Andrikopoulou, one of the leading physicians who is focused on cardiovascular care and equity out there on the West Coast. But without further ado, I'm going to hand over to John to talk to Effie. Go ahead, John.
Hi, Effie. How are you? Good to see you again.
Hi, John. I'm doing well. Very nice to see you too.
Good. You are a distinguished cardiologist and certainly continuing to get a lot of recognition for your expertise in things like artificial intelligence and digital health, and more importantly, the collaborative intelligence, which I think you're credited with having labeled in some fashion. I'm curious that as the issues of innovation, AI, remote monitoring, health economics, et cetera, are all converging on us, how do they really transform cardiovascular care from your point of view? I mean, you're at the front line of actually delivering the solutions to the people in need. I'm curious how that converges on what you do and how you do it.
Absolutely. John, I think you said it exactly right. It really transforms the way we are able to deliver care. I'm going to use a very real life example. Just last week in my clinic, I was talking to one of my patients, and he had one isolated episode of an abnormal heart rhythm once when he was at the hospital. Very young guy, very energetic, very active. He owns a gym. And his question to me was, well, does this one episode of abnormal heart rhythm commit me to blood thinners for the rest of my life? And after we discussed, we realized that it's going to be an incredible opportunity for us to use his smartwatch, his Apple Watch, as a 24/7 cardiac monitor. And if we ever get any notifications of any abnormal heart rhythms, then we can discuss more and we can personalize his management. So I think that is a great example that shows how remote patient monitoring. And by that, I want to make sure that we are talking the same language. I'm not just referring to the typical remote patient monitoring RPM companies who up until now would send digital scales or blood pressure cuffs. I'm referring to wearable devices that are able to capture personalized digital health data that we can then use in our clinical practice, not to react, but to anticipate disease and to enable us to transform the way we deliver care from a reactive to a proactive or anticipatory way. I think that is the key in using RPM and wearables that generate personalized digital health data and how they can very practically transform care. And this was just one very simple example. Now imagine if we also integrate data from other wearables like rings, glasses, vests, you name it. There's things that have come out for every single part of the human body at this point.
Yeah.
It can really transform the way we understand medicine. Up until now, we've been practicing medicine in a way that treats disease, but with these wearables and digital health tools, we can practice medicine in a way that promotes health instead of treating disease.
Well, when you talk about promoting health, I mean, that raises an interesting question, which is, as the technology continues to be more and more accessible to both, those of us who are in need of health care or in need of monitoring, and much more accessible to you as a practitioner and a solution for some of our therapeutic needs, does that widen or reduce the gap in outcomes between, the underserved populations, whether they be rural or economically depressed parts of large cities, or does that actually make it easier to help those people get the treatment they need and the diagnosis they need?
Fantastic question. And it really hits the heart of equitable care delivery. And just like everything in life, nothing is all black or all white. This can go both ways. And that's why I'm going to jump to the solution. And I will say that's why governance and post-deployment monitoring matter when it comes to innovating delivery of care. If we design the AI and innovative solutions in a responsible way and in a thoughtful way that has all of the stakeholders sit at the table, I'm talking about clinicians, patients, technology, insurers, then we can definitely be in a position to bridge disparities and inequity gaps, because we can extend expertise, specialty expertise into primary care and rural areas that are underserved. We can make diagnostics and results more understandable and timely for our communities and our patients to understand and improve their health literacy. And we can, like we said about RPMs and wearables, we can enable detection of disease and risk stratification, how we like to call it, in a much more timely manner. But like you said, we have to make sure that we are inclusive in the way we design these tools, to make sure that we, when designing them, we use diverse data that is representative of the communities and individuals that they are meant to serve. There's no point in me using a tool that has only been tested and validated on men. It's not going to be able to predict or serve me the way it has been designed to. And so that's why we have to be very thoughtful in including traditionally underserved groups of populations, women, racial, ethnic minorities, cultural minorities, and give them a very active seat at the table of co-designing, testing, validating, and, like I said, importantly, post-deployment monitoring. Just because something serves a specific community in its testing environment doesn't mean that it's going to continue serving when we deploy it in the real world.
Sure. Well, you mentioned something interesting a little while ago, which was the use of various tools and easy to use tools, easy to find tools, easy to access tools for monitoring, whether they be smart scales today or blood pressure cuffs or rings and watches, etc. I am a well-measured person when it
Yeah,
comes to in fact, I usually wear more than one ring, but then I look like a gypsy, and so I decided not to do that for this conversation. But the insight that comes from that is very useful to you as a physician, about me as a patient. But then, secondly, the insight that I've gotten as a digital health scientist, if you want to call me that, is that the underlying algorithms become increasingly important to verify and validate and because the credibility of your diagnosis is dependent on what the ring says about me. And so what I found interesting is that if I wear two or three rings, or if I use two or three Apple Watch applications to track something as simple as how do I sleep, I get five different answers. And guess what? They are very different answers. And so, in essence, one of the things that I think is important as you as a physician and I as a patient begin to do is we kind of verify the use of the data and the accuracy of the data because in essence, you can only treat me as well as you can measure me. And if you're measuring me with faulty algorithms, I may not get what I need. So I'm curious if you've got a point of view about that because you're much more deeply into it than I am.
absolutely, absolutely. So this could be an hour-long conversation in and of itself. It's a fascinating topic, and it's a very practical topic because it feels that technology is advancing much faster than clinical medicine and clinical care is able to adapt.
Interesting.
And what I'm trying to say with this is, like you said, you're coming in to see me as a cardiologist and you say, hey, doc, I have all of this data from my ring and my watch and everything that I'm using. Here, you use it so that you can take great care of me. I will say, if only it were that easy for us today. I think things will be different in the future. But today, there is room to cover and opportunity to innovate in the space that will allow seamless integration of this data and processing of this data so that as clinicians, we can make the best use of it. You can understand that we're all humans and there's only so much time in our work days. It's impossible based on today's capabilities that we have to parse through all of this wealth of digital health wearable data, wearable derived data, so that we can use it in a practical way to take excellent care of our patients because we don't have the tools to allow us to parse them quickly and accurately, and in a way that will translate that data into actionable insights. Because we don't have exactly what you said. We don't yet, that's the key word. We don't yet have the validating studies that will translate this data into actionable management steps. And insights. I think that I don't see that in general. I'm an optimist. I don't see that as an issue or a hurdle. I see it as an opportunity to innovate and contribute to improving delivery of care. This is a very important gap and middle step that we have to fill because right now, like you said, we are getting really, really good at collecting an incredible wealth of data, of personalized data. The middle step is how do we process all of this data in a way that a human, the doctor, can then digest and use to then send back to you and take excellent care of you.
So, well, as you know, HitLab is at our core an evidence-based organization. We believe very strongly that the evidence ultimately defines that whether or not a solution produces the outcomes expected, produces the economics that it's intended to achieve, and more importantly, is a basis for changing or improving the therapeutic use by clinicians. When it comes to the question of algorithms and data, we've also stepped up and we are in the process of launching the Center for AI Testing and Evaluation, a place in which questions such as, was enough data assembled to produce an accurate algorithm? Does the algorithm actually predict or diagnose the proper circumstances to lead to improved diagnostics? And so, HitLab, as the operator of and founder of and hopefully deliverer of the solutions, is going to be able to attest to, I almost want to say certify, but that's a pretty strong word, because we believe that's such an important need. So we're going
Absolutely,
to have to
absolutely.
close in a minute. I'm getting pinged here by some of my colleagues that we're having too much fun here.
I know.
But as a clinician, I'm curious, how can startups work with the people who actually practice medicine, deliver solutions to incorporate into your practice flow or your clinical workflow their solutions? Because at the end of the day, a great solution as a standalone is a great solution standing alone. It's got to actually fit into the way you do medicine. So I'm curious how startups can think about and take that step of becoming closer to fitting into your work.
Absolutely. And I'm a huge fan of strategic partnerships and collaborations. And I think that's the key here is to start building, to transition from transactional relationships where a startup finds a medical center or a clinician, they use their data and that's it, to move to more strategic partnerships and meaningful collaborations. Startups bring agility, they bring bold thinking and questioning of the status quo, and health systems on the other side can bring scale, data, and real world complexities. And that's where the magic happens when we bring both of these worlds together by co-designing solutions. So having an active seat at the table for representatives from medical centers, clinicians, nurses, techs, administrators, and to co-design tools based on like HitLab does, based on the values of implementation science and equity and diversity, like we just discussed about. And to define success, to define success metrics, not purely by deployment, not by saying, okay, this is how many accounts we have that have deployed our solution, but to define success metrics based on measurable outcomes across diverse patient groups within that health system that they serve. I think that that would be key.
Well, I'm enjoying the conversation very much, but we're going to have to leave it at that, and we'll use this as the first step of hopefully a continuing dialogue that we can have about so many of these very important topics. And thank you for taking the time, and more importantly, thank you for what you do to help people survive some of the most difficult diseases, which are those of cardiovascular systems. So thank you.
Thank you
Jerry?
so much. Thank you so much, John. Thank you, Jerry.
No, wonderful interview. Thank you, John. And thank you, Effie. Really wonderful to have you both on the program and sharing insights with us. And I do encourage everyone to connect both with Effie and John. Their LinkedIn details are in the chat if you want to continue that conversation with them. Up next, another speaker who was also at the HitLab Summit earlier this month. And I have the pleasure of speaking with today around leveraging AI for behavior change and public impact. Brittany from CVS Health presented on the very same topic at the summit earlier on this month. Brittany, lovely to have you on the program. Again, this time in a virtual setting. For those that didn't have the pleasure of seeing you earlier on in the month, we'd love to hear a quick 60-second background about the work that you're doing at CVS Health right now.
Yeah, absolutely. So I am a lead director on some of our wellness platforms, looking at how can we make it easier to be healthy. My talk at the summit focused on my expertise based on the breadth of my career, so not just my work at CVS, which I'll look forward to, talking in that same broad spectrum today, but looking across the healthcare ecosystem between private sector, academia, public sector. What does that mean for all of these different stakeholders about how we could leverage AI for population behavior change?
We've heard a few of the speakers today talk about how important behavioral focus is when it comes to dealing with patients. How is AI, especially currently being used to influence behavior change? And of course, from your perspective, at a scale in public health initiatives right now?
Yeah, absolutely. So when I talk about behavior change, I'm thinking about how we eat, how we sleep, how we get around, how we move, how we interact with one another. And all of those behaviors are determinants of chronic disease. And we've only seen that incidence rising. But in the last, I would say, 20 years, our world has become increasingly digital, and now there's this data abundance. And we're now kind of at the beginning of a new chapter where we're now starting to make meaning of this data, which makes it very impactful. So when we're thinking about AI and what can happen at the population level, we're now creating a layer on top of that data. And when I say, this data abundance, I'm talking about physiological sensors, we have our activity history, we have wearables, there's browser data on all of the different tools and platforms we engage with. We have geolocalization data based on our maps and how we move around. There's weather data. People are even using personal CGMs these days. And all of those are now inputs into AI. And what I think is really exciting is that we're now seeing the advent of these health coaches. So these AI powered health assistants, and whether that is in your phone, whether that is facilitated by your wearable, whether that is in your internet platform or your Gen AI tool of choice, we now have a way to make meaning of that data. And that's where I see a lot of potential, where we're going to see the ability to make sense of it, to personalize interventions at scale. And that's really the difference that AI is going to allow, is that instead of going in the inverse, which has traditionally been the case in health intervention design, where we start at the top, at the population, and try to make it work for the individual, we're now starting in the opposite, where we can build for the individual and scale that out to populations.
Yeah, absolutely. And on the topic of interventions, what are some of the examples of successful AI-powered interventions that have improved health outcomes in the real world communities that you've observed?
Yeah, absolutely. So I would say those health coaches, which are examples that use Gen AI, are new, and we don't yet have the data there. And I'm very curious to see what studies will be conducted to evaluate those today. You could even see it in terms of the hiring patterns of some of these large tech companies, that this is now a priority where they're trying to invest. But if we're looking at AI and the impact in public health so far, a lot of that has been in older versions of AI, so not generative AI. So, and we have to remember, I think it's very easy to get lost in conversations right now with generative AI as the newest tool and because of its accessibility to the masses. But AI has historically been based on machine learning rather than the focus on natural language processing today. And if we're looking at machine learning, AI has really been at the basis of a lot of disease forecasting. That if we look at prediction and surveillance and understanding trends in populations, that is the bread and butter of public health departments. And if you're looking at epidemiology, so I think it's important not to lose sight of that AI is bigger than Gen AI. And it's really important for any team to consider their problem first before assigning a tool to use it. So, what is it that you're trying to solve? What is it that is the pain point for your end user? And then consider the tool that would make most sense to solve it. And I think it's very easy to get caught up in the latest and greatest and trying to use the most newfangled invention, but that's not always what's most appropriate. So I think there's a tremendous history of other data-based solutions that have been effective. And I think it's important to keep that breadth of consideration when developing new products.
Yeah, that's definitely really important to keep top of mind for sure. One of the things that Effie just talked about was around making sure that we have technology to be, deployed equitably and stuff, especially to historically marginalized and rural populations. How is it that we can ensure, especially AI tools, are built and deployed equitably?
Absolutely. So I think it really matters about the inputs. So when we're looking at ethical considerations, there are a few things to keep in mind to make sure that these solutions are being built equitably. So first, we have to think about data quality. Data out is only as good as the data that goes in. So if we're training certain models, we need to consider what has informed their development. And right now, if we're building on AI models, which is definitely what most people want to talk about, the general models might not be most impactful for your population, or you might need to consider what was this trained on? Has this considered the nuances of my population? And that really goes back to some of the basics of public health intervention design. When you're looking at implementation science, you often have to consider cultural adaptation. Is this applicable for the people that I'm trying to help? One thing in particular there is, language. Does this model react or behave as effectively for non-English speakers? What about those with low levels of literacy? Is it really contingent on phrasing certain prompts well, or if you're especially asking for responses and more like agentic solutions where there's a dynamic conversation back and forth, often uh, things don't go as well if you're not phrasing things exactly as they're expecting it to be phrased. So I think being prepared for that and testing things is super important. And that comes back to evaluation as well. Like we can't assume that things have been built the way you want them to have been built, especially if you didn't train them yourself. So you could use AI on itself for that evaluation. Give the prompts of, is this going to work as well for someone with a reading level below the fourth grade, which we know is the standard in products targeting the Medicaid market in the United States? How is it for, someone who can't speak articulately? What if someone is not verbal? What are other ways to engage with this? Are there any accessibility concerns? Feed the AI the accessibility guidelines or compliance standard that you're using. But I think it's important if you're starting to build on top of public models, or if you're not working with a specialized trained models. There's definitely new companies that are building those especially trained models today, but develop that framework, develop that rubric, and test it out. And you'll see that different products will yield different solutions. So I think it's really important not to expect, even though it often feels like magic, it's not. It was built by humans for a specific use case, which wasn't yours. And if you weren't in that room, we need to consider how to evaluate it to make sure that it can be equitable and inclusive. But I think until policy catches up, that onus is really on the stakeholders leveraging these tools to ensure that they meet their needs. But hopefully, we get to that point where those considerations are accounted for by regulation.
Yeah, are there any sort of specific ethical considerations, like sort of further that you feel that should be addressed when using the AI to sort of nudge or modify health behaviors in essence?
Yeah, so I think when we're also thinking about ethical considerations, like we really need to consider trust and how data is being used. What is that ownership? Does the end user really understand how how their personal information will be leveraged by the entity that, is absorbing it. I think you really need to build that trust and institute governance protocols, which remains a huge barrier to adoption, especially if we're looking at those populations who could most benefit from new solutions and who have been historically excluded from other interventions. It's really important that they have trust in the products that are being delivered to them. So I think it's really important to consider who is the face of that solution. So especially if we're talking about this coaching or personalized prevention, I think collaboration is really key. That public-private partnerships are essential for meaningful impact, and considering how can you layer on those elements of trust on top of technology that was developed by the private sector, because that's often, it's not necessarily part of their end goals, but I think it's by creating those shared goals and ensuring there are stakeholders who have those best interests at top of mind that we'll see success there. Because I think we're at this cataclysmic moment where the decisions we make are going to affect the longevity of these solutions. Will the populations who we can potentially help the most buy into these tools, or will we push them away? I think, public health, there's been a lot of lessons in history in the US about how individuals were taken advantage of by researchers, why populations have shunned, new interventions because of that lack of trust and because they haven't been considered shared partners in that implementation. And I think in this new chapter, there's an opportunity to do things better and to do things right. I think we've learned a lot over decades, I would say even centuries at this point. And, as the people making those decisions now, can we do better? That can we ensure that these new interventions are equitably distributed and that we consider, the rights of everyone who will be touched by this new technology.
Yeah, some really important considerations to take into account, I think, especially, as you said, when you're looking at the larger scale of, public health and population health, there's so many different levels of health literacy and just sort of overall understanding as to how to navigate the healthcare system and so forth. And it really is important to use AI to the best effect to address all those pieces. Just to round off, Brittany, if you look into Brittany's crystal ball for the next sort of 3 to 5 years, with AI and just digital health technology in general rapidly evolving, how do you see AI evolving in the next couple of years when it comes to preventing, predicting, and also modifying health behaviors across all the different populations?
Yeah, absolutely. So I think this combination of generative AI and this influx of data sources has really democratized access to personalized health insights. And I think the question is, how is that going to become scalable to everyone? So if I had a crystal ball and if I was able to, wave my magic wand that we see the industry move in the direction that I would hope it moves, is, everyone has their own personal health AI assistant. You have your own personal health coach that it's based on your inputs and what matters to you. Because even if the two of us had the same health conditions, if we live in the exact same place, if we have the same literacy language, we still won't be exactly the same. There still will be nuances to each of us and our goals, especially when you think about behavior change, our sources of motivation. And that's really internal to us, of what drives us, what is going to make me most likely to take action to see improvements in my health outcome. So you start to see changes in that incidence curve of chronic disease. And in 3 to 5 years, I would hope we start bending that curve, that because we all have these individually tailored solutions that that it's finally easier to change behaviors. It's so hard. Anyone who has worked on it themselves, all of us has an element that, for which we're not perfect, that we wish our behaviors were better. And if we could actually make that easier, and that's been the question we've been working on for so long. I've been working in this space over a decade. It's still the question that I think about every day. How can we make it easier to be healthy? I hope in the next 3 to 5 years that it is easier.
No, absolutely. Brittany, thanks so much for coming onto the program and sharing your insights with us. It's such a pleasure to speak with you. And I wish we could have had more time to flesh out, how AI is being used for public impact and so forth. But I do encourage everybody in the audience to connect with Brittany. We did put her LinkedIn details in the chat, and it was a pleasure to be able to see you in person as well. And hopefully we'll have you back on the program again soon, Brittany, to talk further about this.
Absolutely. Thank you, Jerry.
Thanks so much. Okay, wonderful. Well, it's been a pleasure having a lot of the folks on the program this morning and this afternoon, if you are based over here in the US, speaking about some of the topics and insights that they shared and continue to share from the HitLab Summit. And another speaker today that we have on is Ilka from Pons, who unfortunately wasn't at the summit earlier on in the month, but has been part of the HitLab community for a while and actually took part in one of our recent HitLab challenges and actually, I think, came out as one of the top startups from that. And he has prepared a short presentation for us around improving ultrasound clarity and clinical confidence with the solution that Pons has developed and is developing at the moment. Ilka, are you there?
Yep. Can you guys hear me?
We can hear you. We can hear you.
And I hope you can see my screen as well.
We can see you starting to share your screen. So I'll hand over to you, Ilka, and I do encourage everyone again to check out Pons. And there is some information on the HitLab website around one of the studies that we did with Pons as well, which I also encourage everyone to check out. But I will hand over this last segment over to you, Ilka.
Thank you. Thank you again for the kind invitation and introduction. We're very happy to be part of HitLab as well. And then, so basically, I'm an associate professor in the Department of Radiology and Medicine at the University of British Columbia in Canada. But prior to that, I was a professor at Rutgers University in Biomedical Engineering Department. And right before I made the switch, we founded Pons. And then my main research interest, and as well as Pons' interest, is improving the clarity of ultrasound data so that this technology can be used outside the traditional hospital settings for early stage disease management. And then we're showing basically, I'm going to show some of the results that we obtained from our pilot studies, how we are improving the accuracy and robustness of different AI solutions that are using ultrasound data for diagnosing different diseases. So before I wanted to dive into our results, I want to basically explain why we are trying to bring ultrasound outside traditional hospital settings. So the future of healthcare is shifting, and we see more and more research hospitals, major hospitals, trying to move their patient to outpatient and hospital at home care. In such a decentralized care setting, we also need imaging solutions that are equally scalable. And ultrasound lends itself to this kind of decentralized healthcare solution as well. The other thing we also see is chronic diseases are on the rise. And in Canada, this number, in the US, it's 63%. And in Canada, it jumps up to 88%. And then another challenge is right now, once you have one chronic condition, you also end up having a secondary chronic condition due to the first condition. So it gets very challenging for the healthcare systems to diagnose these diseases early and manage them better. So there's a big shift right now in healthcare ecosystem for basically towards a proactive system rather than a reactive care. And as Pons, our main focus area is breast cancer, because we've seen a rise of breast cancer cases, and we want to identify breast cancer at an earlier stage. And then our secondary interest is on liver disease. So the other thing, basically pushes our technology is we have an aging population. A lot of these aging people would like to age in place. They want basically healthcare technologies to come to their home where they feel comfortable. They don't have to travel 3-4 hours to the nearest hospital and get equal quality of care. And because of this, we have a lot of decentralized healthcare technologies that adapt to itself inside this decentralized care solution, but we don't have an imaging solution. That's why we're trying to fill that gap as Pons as well. And one of the main reasons when we started the company, was basically the missing data inside the healthcare ecosystem. So we have most of the data is collected inside the hospital setting. So we have data from healthy people, and we have data from basically people who are admitted to the hospital, or they come back after to their regular checkups after a year and diagnosed with late stage chronic disease, right? So we don't have the data that's in between these two extreme cases, which is the data on early stage disease. And that data can be collected if we can monitor patients more frequently and outside the traditional hospital settings, as I mentioned earlier. And this is like a statistics from Philips Future Healthcare Index report conducted in 2024. And then we can see that basically major research hospitals are really focusing in the next 3 to 4 years their efforts for using and deploying technologies, healthcare technologies that are focused on remote patient monitoring. And this is, again, one of the reasons where there's a shift to outpatient care and hospital at home care in around the world, not just in the US. So why ultrasound? Again, as we can see, there's different point of care ultrasound devices available in the market. These are small handheld units. Cost is low. You can basically take it anywhere you go. It's connected to a cell phone or a tablet. But the main challenges with ultrasound still remain the same. So one of the major challenges, it's the image quality is very low to begin with. And anytime you shrink an imaging modality to a compact size that is shown here in the slide, you lose further from that image quality. So we need technologies that can improve the quality of the data. The second thing is data collection is manual. You need ultrasound technicians are trained to do this data collection process. It's basically requires expertise, a lot of years of training. And if you want to basically bring this imaging technology outside the traditional hospital settings and deploy novice users like caregivers or nurses to collect ultrasound data, you need solutions that can fill that gap. So an AI-based navigation systems are perfect in this setting, and we are developing that as well. And there's a lot of companies that are interested in that area. There's a huge shift right now from the robotic healthcare industry that combine AI-based robotic navigation as well. And early stage disease imaging is very, very challenging with ultrasound data. If it's a late stage disease that's present, ultrasound can show the disease tissue changes clearly. You don't need an AI in that part. Radiologists are happy for that. But showing early stage disease changes is very challenging. And this is the secondary thing that we're addressing as Pons, and data scarcity. Compared to cart-based systems, point of care ultrasound data is still scarce. And overall, ultrasound as an imaging modality as low data set size compared to MRI, X-ray, or CT imaging modalities as well. So we're trying to tackle these challenges. So the other thing with ultrasound is, depending on the settings, differently, a lot of basically manufacturers have their custom image processing methods. And then, as you can see, this is basically from a publication that assessed the quality of different ultrasound anatomy. You see a difference in the image quality. So that's a significant problem, first for assessing the disease at an early stage. Second, if you develop it from one location, the AI is strong because you trained it on that data. But if you want to deploy that AI solution using a different machine at a different hospital site, the AI accuracy and robustness basically decreases significantly. And we wanted to basically overcome that challenge as Pons. Again, this is one example. For example, a hospital site domain changes. It's in the AI literature, it's called like that. If you collect ultrasound data based on specific settings, these are breast ultrasound tumor tissue in one hospital site located in hospital one. If you switch to a different site, you can see, although you're imaging the similar tumor stages or disease stages, the image quality and appearance of the tumor changes drastically. So if you train an AI solution on data that is like the one shown on the left-hand side, and then you want to deploy that AI on data collected at a different site that looks like this on the right-hand side, the robustness of AI solutions decrease significantly. So what we have done, we have developed a technology that basically improves the visibility of early stage disease, number one, brings the imaging features into a common domain so that the AI solutions are not affected by these basically data machine settings as well as data collected at different hospital sites. So it becomes the AI solutions trained on our enhanced images become more robust. So we're evaluating our technology in different anatomical regions. Again, as I said, breast and liver are original two application areas. And this is one of the things that this technology is advantage of this technology is it's not a traditional AI solution. It's a sophisticated image analysis method. So we don't need large scale AI to train this. It works without a training data. It enhances the ultrasound data. It's device agnostic. It enhances any ultrasound data collected from any machine. We basically improve the visibility of early stage disease from different data sets. And we bring the imaging modalities into a common domain. Here, for example, we show an ultrasound traditional image, contrast enhanced ultrasound image, which is obtained by injecting a contrast agent to improve the visibility of a tumor. But we can do a similar enhancement without injecting a contrast agent, which is a significant advantage. We also started basically because we were asked by our pilot partners, can we use this enhancement on different imaging modalities? And we are also showing that we can. For example, we can enhance the tumor visibility from CT data and generate more images. And here we can see basically the visibility of tumor region here that is barely visible in the ultrasound data for a liver tumor. So the second thing what we can do is with our technology is we scale the data set size. As we know, the more data you have, the accuracy and robustness of AI solutions, healthcare AI solutions improve significantly. So what we can do is from a single image that is shown here, we can generate all these images that we show on the right-hand side. So what happens, the advantage of this is if you have an AI solution, let's say you develop a healthcare AI solution for disease diagnostics or risk assessment, object detection, segmentation, whatever you can think of, imagine training that AI solution using this large-scale data set versus training that on a small scale data set. And that, again, we show that our results, the robustness and accuracy improves using our image enhancement methods. So we are basically develop different risk assessment and disease diagnostics AI solutions that use the enhanced data sets. And we are basically the company that knows how to combine these information that you can extract from these different enhanced images and using the original ultrasound data as well. These are some of our initial results. We're very happy to show this. So this is basically the red bars show when an AI solution is trained for differentiating non-alcoholic fatty liver disease from NASH, which is basically early stage liver diseases. If you had an AI solution trained on original ultrasound data, the red bars show what kind of accuracies you will achieve for different basically age groups, different sex, female versus male, ethnicity, race, and location. Location is the data where the ultrasound data is collected. And the blue bars, as you can that are shown here, are using an same AI solution trained on our enhanced images. So we can see that the accuracy and robustness significantly improves. So it's basically, it becomes more robust for age groups, for sex, ethnicity, race, and location data as well. This is exactly what we've been telling about, and we showed these results as well. And we will be publishing this in the near future, this end of the summer, for liver disease as well as breast disease as well. And we are very happy to show these results right now and share this with the HitLab Summit. And this is basically fantastic for now. And The other thing we knew, you have to think about it, and we started thinking about this. Okay, we want to bring imaging modality outside the traditional hospital settings, right? You go outside to the basically sites where there's no safeguards in place, right? So one of the things that you need to consider at that point, privacy of the medical data you're collecting. It has to be still secure enough to collect. Once you collect it, it has to be secure to transfer to the hospital site. So your solutions have to be robust enough for attacks that can be done from hackers. We have seen that a lot of basically major research hospitals being hacked or software device companies being hacked by hackers. So we basically investigated this idea, and then we are developing also training our solutions on data that is generated that has adversarial attacks basically embedded into them. So here we can see this is the top row shows the original ultrasound data. The bottom row shows the ultrasound images we are synthesizing. These are fake images. And if your AI solution is attacked by these, your architecture will be hacked by hackers. So when we generate these images, we can provide these images to software companies who are developing AI solutions, and their network architectures will be more robust to the attacks that are brought by hackers, basically. Because this is an interesting, very important problem if you're deploying imaging solutions outside the traditional hospital settings. And this is, again, thank you for having me. And then if you want to connect with me, please scan this barcode. I'm happy to answer any questions you might have.
Really phenomenal progress that you guys have made since I think we last had you on the program. Just before you go, I think we'd love to hear sort of the upcoming sort of goals and developments you're looking to make with PONS in the next sort of 6 to 12 months.
Yeah, that's a great. Again, and we are starting a lot of pilot studies. We're finishing one of our pilot studies with Mayo Clinic this summer, so that will be published on breast and liver disease. We will be starting 2 new pilots we're very excited about with Memorial Sloan Kettering Cancer Center on breast cancer. And then the second one will be on deploying our solutions through a pilot study with Rutgers, Robert Wood Johnson University Hospital, focusing on African American population, again, on liver disease. Those will be the 2 focuses that we have. But we are very happy with the initial pilot results that I shared here through the Mayo Clinic Platform Accelerate program. And then, that will be the focus moving forward and further improve our technology. And then if anyone would like to learn more about what we're doing, they can just feel free to reach out to me. I'm happy to connect and then share our experiences as well.
No, that's really wonderful. Really looking forward to seeing where you guys go with this. Congratulations on your recent results and evidence, of course, coming from HitLab, that's very much focused on making sure that good technology like yours is getting the evidence it needs to make sure that you can effectively show what you guys are doing and the important work you're doing. So thank you for that, Ilka, and we look forward to having you at the summit, hopefully coming up in December.
Yeah, thank you so much. Again, we're very happy to have the support of HitLab and very excited that we are part of this.
Wonderful. Thanks so much. It has been a really great program today, being able to hear from speakers talking about a range of different topics, a lot of it coming from the recent New York City Health Innovation Week and HitLab Summit that took place earlier this month. And it was really great to be able to hear some continuing insights and conversations from them. I do encourage everybody to connect with them via the chat. So if you did join a little bit late, scroll up through the chat and find out the LinkedIn contact details for any of the speakers you may have missed. Just to round off the symposium for today, for the last couple of minutes, if I could grab everyone's attention before we hop off and get ready for our afternoon or late morning meetings, depending on where you are in the world. I want to just let everybody know about some exciting new developments that are coming through the HitLab community. Something that Bill Taranto, Amy West mentioned earlier, that really it takes the community to really come together to be able to advance the way that healthcare is being delivered through technology and to be able to support each other as these different solutions are coming through the industry. HitLab has put together a range of different initiatives and memberships The Breakthrough Alliance, of course, being one which is separated into the board and the fellowship. The Women's Health Tech Initiative, led by Amy West, and up and coming, if you weren't at the HitLab Summit, we are going to be announcing very shortly in a very official capacity the Center for AI Testing and Evidence, as John Hammett mentioned earlier. And those three communities are going to have access to what you see on the screen here, the HitLab Hub, which is going to be the main portal for all of our community to be able to, in those initiatives, connect with each other, be able to form different groups and conversations, and also get access to some of the more exclusive programming that we do have available for those members as well, which include HitLab Share sessions, where some of the speakers that you've seen on today's symposium and the HitLab Summit and other programs that you may have seen in the past share some insights from those programs and from the work that they're doing at the moment. And the audience at those sessions have an opportunity to actually be able to directly interact through Q&A and open discussion at those sessions as well. So I do encourage everybody in the audience, if you aren't part of one of those memberships or initiatives, check out the memberships and initiatives page on HitLab to find out how you can get more involved. If you do miss any of those sessions on the HitLab Hub, the recordings of those sessions are available to our members. So if you are busy with other meetings or other commitments, we do have that repository for you to be able to go back and look at previous HitLab shares and exclusive sessions that you may have missed, as well as the transcripts from some of the Women's Health Tech and the HitLab Symposium chats that you may miss if, again, you either join late or you are not able to join at all. So do keep an eye on that. Join one of those initiatives or one of those memberships if you are interested in getting more involved in the community, whether it's Women's Health Tech, whether it's Breakthrough Alliance, or whether it's the Center for AI Testing and Evidence. And please feel free to drop me a line on LinkedIn if you want any further information on that. But that rounds off hour 3 and the HitLab symposium as a whole. We'd love to thank all of the speakers that have come on today, of course, and without them, we definitely wouldn't have a program to bring to you today. So really appreciate everybody's time that they gave to the program for today. And that doesn't end there. Don't forget to register for the June symposium, the last Thursday of the month again, this time focusing on health equity and the digital health ecosystem. We'll have folks like Chrysanthi Dori, who's going to be heading up our new Center for AI Testing and Evidence initiative, from Medidata, Yong Wong, who was actually speaking at the summit earlier on this month. And then we have Mark and Meghana, who were also on the summit earlier on this month as well. So you'll get the chance to hear from them almost as a continuation from this symposium into June, if you are interested in hearing more from the speakers of the summit. And just as a reminder, there are some really great benefits to join the Breakthrough Alliance, whether it's at the board level and at an organization level, getting connected to Bill Toronto and Amy West and other folks that are part of the board, or on an individual basis and taking part in the HitLab shares and the networking, as I mentioned earlier. Women's Health Tech Wednesdays is continuing all the way through summer. So whether you are at work, at your desk, or on vacation, you can tune in. We have a really wonderful program that Ansley and Amy and the rest of the Women's Health Tech team have put together every Wednesday, 12:30 to 1 p.m. Eastern. Do make sure that you register so you're kept up to date as to who's going to be on each week. And again, really do encourage everyone to check the program out and tune in each week to hear from a female leader in the healthcare industry. The HitLab staff have to be thanked, of course, for bringing together the program today, of which we wouldn't be able to bring you this amazing content. So thank you to Rachel, Ansley, Raymond, Pallavi, Melissa, Nico, Rijo, and of course Stan Kuchinowski, Amy West, and John Hammett for bringing the program to you today. And our conversations today wouldn't be available and be brought to you without the help and generous sponsorship and partnership of our collaborators from the Merck Global Health Innovation Fund, FFF Enterprises, Microsoft, IMC, Helix VM, Fin Partners, and of course, Actual Healthcare Solutions, some of which you heard from today. So if you do want to help support the programming that is largely brought to the community for free, please do reach out to me and Stan and show your support and be part of the wider HitLab ecosystem. But until next month or the next Women's Health Tech Wednesday, it's goodbye from me and the rest of the HitLab team. We wish you a great weekend and rest of the month. Goodbye.